House File number 2435, number 1 on the calendar for the day, an act relating to state government, modifying provisions related to health finance and policy, the second engrossment.
There are amendments at the desk, but if it is without any objection, we'll allow the author of the bill to speak first. I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Appreciate the time to present House File 2435. Members, the health finance bill before you today is focused on delivering better health care access and meeting some of the most pressing needs of our state. A few examples: the extension of the telehealth is an area that we need to address and make sure that the coverage that people are using across the state for access to telehealth continues to be available. We also are creating a budget-neutral federal state directed payment program for every hospital in the state, which will increase medical assistance rates. That's brought to us by Representative Nadeau. We helped our state's pharmacies with a directed dispensing payment program by Rep. Bonner, and we're helping foreign medical school graduate licensing modifications with Rep. Mahmoud. Support for the Rare Disease Advisory Council comes to us by Rep. Murphy, and adding newborn screening for metachromatic leukodystrophy by Rep. Torkelson. MA coverage for traditional healing, Rep. Keeler. We also maintain the critical infrastructure supports of public health at MDH by maintaining their operating budget and increasing $1 million per biennium. And we combat the opioid use in a number of ways. My bill for education, an antagonist bill by Rep. Schumacher, and opioid directives for non-usage and health records by Representative Baker. We've increased funding for emergency medical services from Rep. Backer, co-chair Backer, I might add, and further work on the medication repository program from Rep. Hemmingson-Yeager. As all our wonderful committee members know, we see in Health Committee that the needs are always great, and one bill will never solve all the issues before us. But this committee worked hard and in a bipartisan fashion, and this bill will make a significant difference for the people in our state. I want to thank my co-chair, Rep. Backer, Vice Chairs Ryer, and Vice Chair Rep. Nadeau, and all the members on the Healthcare Committee for your work. I look forward to the discussion and would like to provide Co-Chair Backer an opportunity for comment at this time as well. Before we move to amendments, please, Mr. Speaker.
Representative Backer is not currently on the floor. I recognize the member from Anoka, Representative West.
Thank you, Mr. Speaker. To the great chagrin of my co-chair and I, we are lumped in with the Venerable Chair Bierman and Chair Backer and their health bill. So the children and families portion of the health bill covers just over $2 billion in spending, and I would say of that $2.1 billion, the most interesting $40 million are the $40 million going to SSIS to finally modernize the system. And what's funny is I've heard we need to fund SSIS for like 15, 20 years. That's a lie, more like 10 to 15. But still, I can't believe it hasn't been done. And I'm very proud that we are able to do it in this bill here today. This bill also has a number of important provisions around child maltreatment, ensuring we're holding people accountable and detecting it as soon as we can, protecting children into the future. There's also a wonderful provision in the health side of the bill that requires, at a child's first well visit, parents to be educated on recognizing and reporting abuse. Because we have seen in this state, we have a lot of maltreatment problems, even though we are a mere state of 5.7 million people. The bill also puts a modest one-time increase into our early learning scholarships program at $5.85 million. And overall, I would say it's not a revolutionary, we are going to totally fix the system, but it takes numerous small steps in the right direction so that, well, we're not going to solve all our problems today. We are definitely going to stem the bleeding of our child care providers provide some support, and keep our public assistance systems running and working into the future. So it's a pretty decent bill. We got a lot of amendments to work through, but only a few relating to the children and families portion of the bill. And how those amendments go might actually change votes on either the underlying bill or on other amendments. So I'd encourage members to have their bipartisan caps on and work together to get important provisions through.
I recognize the member from Hennepin, Representative Katiza-Watun.
Thank you, Mr. Speaker. And members, as Chair West stated, this bill really does a lot of good bipartisan work in order to make sure that we are making investments in the future of Minnesota, which of course is in our littlest learners and their families. So making sure that we were not going backwards on our commitment to those families, to those children. We are able to continue making investments, supporting child care providers, investing in changes, preventing fraud, and making sure that we continue to strengthen the systems that exist currently in Minnesota. I look forward to the discussion today, and that's all that I have to say right now.
I recognize the member from Traverse, Representative Backer.
Yeah, I understand I was called earlier as taking care of my health using the restrooms. So anyway, so health matters. There you go. So, well, members, thank you. We have the health bill, which is always probably one of the most interesting ones, and they generally save it to the last, or one of the last, so they save the best to the last. A couple things I want to talk about. Our healthcare system in Minnesota is fragile, and this bill does a lot of things. Working with Co-Chair Bierman, we have done a lot of good things in this bill. For example, we focus on funding for Minnesotans, especially in greater Minnesota, because guess what happened this weekend, folks? It was nice weather. Any of us who had to travel west out of the cities on Friday was very slow traveling, because our Minnesotans from the metro area loves to head out west or north or south and so forth. So we wanted to strengthen those critical care access hospitals, all hospitals, but especially in greater Minnesota, and this bill does it in a big way. EMS, we've been talking about EMS, and last year, we got a bump with EMS. This year, we took a big step forward, because when someone dials 911, you want the rigs to roll out of the garage, like a good friend of mine would say. We also address pharmacies that we've not seen done, because healthcare, we know how many individuals use meds in their life, so we strengthen that. And then also we focused on programs that actually worked, and we did not put additional burdens on Minnesotans with high tax increases like we have seen other body do. So with that, we'll get through the amendments, and thank you much.
There's an amendment at the desk. The chief clerk will report the amendment.
Bierman moves to amend House File Number 2435, the second engrossment. The amendment is coded A23.
There is an amendment to the amendment at the desk, but we generally allow the author of the amendment to speak to it first. But I see that the amendment to the amendment is also the amendment's author. Would you like us to process this first?
Mr. Speaker, the 823, I would process that one. The 823 is simply a recommendation by nonpartisan staff. It's technical changes and correcting some duplication. So that is just a technical amendment from nonpartisan.
There's an amendment to the amendment at the desk. The chief clerk will report the amendment to the amendment.
Bierman moves to amend the Bierman amendment to House File Number 2435, the second engrossment. The amendment to the amendment is coded A33.
I recognize the author of the amendment to the amendment, the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. This one is, the author is choosing to pull this bill from the packet today to continue further work on it, so we are withdrawing that bill.
Representative Bierman withdraws the amendment to the amendment?
We are withdrawing the House File 1010 from this legislation.
Oh,
That's what the amendment does, the A33.
perfect. Any discussion on the amendment to the amendment? I recognize the member from Traverse, Representative Backer.
Yeah, I would ask members to support this.
I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker, and thank you, Representative Bierman, for removing that section, or removing House File 1010. That is a bill that should have come to the Judiciary and Civil Law Committee for numerous reasons. There's data provisions, there's civil penalties, malpractice, sections regarding the courts, and immunity, and certainly I had a bill to do the same thing, as you know, or an amendment to do the same thing, so I appreciate you doing that, and I think it should be further vetted, and hopefully next year that can happen. Thank you.
Any further discussion to the amendment to the amendment? Seeing none, all those in favor of the amendment to the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment to the amendment is adopted. To the underlying amendment, I recognize the author of the amendment, the member from Dakota, Representative Bierman.
Thank you, Mr. Chair. That is the technical amendment and would like to proceed with that one as well. Ask members to support it.
Any further discussion? I recognize the member from Traverse, Representative Backer.
Ditto. Support. Vote yes.
Any further discussion? Seeing none, all those in favor of the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Robbins moves to amend House File number 2435, the second engrossment as amended. The amendment is coded A15.
I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker and members. I am bringing this amendment, which basically would require consent before someone is given a sensitive exam while they're unconscious. I have been working on this bill, as has Representative Kayla Berg. We have been working on it together this session, and I've had it, I think, for 6 years now. And this is very important, members. When I first started working on this bill, only 8 other states had this in law, and now more than 20 do. We are behind the curve on this one. So what basically it means is that if someone is undergoing a procedure like a colonoscopy or some other sort of medical procedure where they're anesthetized, medical students cannot practice sensitive exams on them as part of their training unless there has been prior consent. And this is very important, members, that if you're conscious and a medical student is in the room, they ask your consent to be part of the exam, to be part of the conversation, to just be present. So there's no reason we shouldn't also get consent prior to someone being anesthetized if the intention is for medical students to be learning their trade. So I hope members will support this. I know there's been some talk that this really doesn't belong in this bill because it's policy and it's going to go through on the policy bill on Thursday. I hope that is true, members. But the reality is that this is the budget bill. And the policy bill doesn't have to happen this year, but the budget bill does. And so this is belt and suspenders so that we make sure after 6 years of discussing this or not discussing this in the legislature, we finally get this done and we protect Minnesotans throughout our state. So I urge a green vote, and I appreciate everyone's time. Thank you.
I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, Representative Robbins. And this was a bipartisan presentation in committee. Members support this broadly. So thanks for bringing it forward.
All those in favor of the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Novotny moves to amend House File number 2435, the second engrossment as amended. The amendment is coded A16.
I recognize the member from Sherburne, Representative Novotny.
Thank you, Mr. Speaker. The amendment that I had brought, A16, it has clarifying language that makes Minnesota state statute clearer. Right now, there is allowances for the depositing or the leaving of a newborn baby at fire stations and hospitals and emergency rooms. Under current state law, it's not specific language, and I haven't had a chance to look it up today, but when we heard this in committee, the Department of Public Safety lists, for example, the Elk River Fire Department as someplace that a baby could be surrendered under current statutes that allow the surrender of a baby under safe conditions. The only problem is the Elk River Fire Station, number one, doesn't have and doesn't exactly meet the requirements for this law. My amendment is a bill that I had that would clarify that law. Now, I'm told that this is part of the policy bill, so I was wondering, Mr. Speaker, if Representative Long would yield for a question.
He will yield. Representative Novotny.
Representative Long, this is part of the policy bill, and I'm told that's stalled. Do we know when the policy bill will be coming to the floor?
Representative Long.
Thank you, Representative Novotny. Yes, we've proposed calendaring the policy bill for Thursday.
Representative Novotny.
Thank you, Mr. Speaker, and thank you, Representative Long, for that information. With that, I think this is a good bill. It'll make a difference, and I look forward to this being approved as part of the policy bill. And with that, I withdraw the amendment.
Representative Novotny withdraws the amendment. There is an amendment at the desk. The Chief Clerk will report the amendment.
Backer moves to amend House File Number 2435, the second engrossment as amended. The amendment is coded A22.
I recognize the member from Traverse, Representative Backer.
Yeah, Mr. Speaker and member, what this amendment does, first of all, it's language that came from MDH for clarification when hospitals close. And that was passed in 2024. And with MDH working on that along with the Hospital Association, both of them agree to this amendment. So it defines what a controlling identity is. Along with it, it proposes languages in terms of patient services. And then it talks about having hearings and clearly outlines this. Again, this is an issue that was worked upon between the department and the Hospital Association, and I would ask for a green vote, members. Thank you.
I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker, and I recommend a green vote as well. Thank you.
Any further discussion of the amendment? Seeing none, all those in favor, please signify by saying aye. All those opposed say nay. The amendment prevails. There is an amendment at the desk. The Chief Clerk will report the amendment.
Dotseth moves to amend House File Number 2435, the second engrossment as amended. The amendment is coded A21.
I recognize the member from Carleton, Representative Dotseth.
Thank you, Mr. Speaker, members. You know, when I started out in the legislation, I never thought that I'd be speaking on behalf of burials and cemeteries, but here I am today. Thank you, Representative Hewitt, for that. With that said, I started out, this is a bill that actually put some guardrails in place. A little over 3 years ago, Representative Hewitt was kind enough to actually carry a bill that I went as a co-sponsor on to actually put a moratorium so we could actually get some guidance on a proper process as we move forward. Now that a moratorium is coming to expire here within the next 45 days, and we finally received back a report from the Department of Health that actually gives us some guidance on what that should look like. With that, I'm actually asking that you support the Green Burial Bill. Thank you.
I recognize the member from Dakota, Representative Hewitt.
Thank you, Mr. Speaker and members. It was great to have Representative Dorseth take this bill because I don't want to be known as the Green Burial guy. This is a great bill. This is one we've been working on for years, and people before me have been working on it. It really puts in guardrails and actually gives a lot of local control, which I think we needed in this space. We can't always set rules and tell our counties and our cities what to do, especially when it comes to land use. And that's exactly what this bill does, is give them a lot more coverage to deal with this. You can't just plop a cemetery in the middle of Main Street, and I think that's kind of what we were going at here. So it gives them those guardrails, and I think we can all agree to this. Please vote green.
Any further discussion? Seeing none, all those in favor of the amendment, please signify by saying aye. All opposed, say nay. The motion prevails. The amendment is adopted. There is an amendment at the desk. The chief clerk will report the amendment.
DePel moves to amend House Bill number 2435, the second engrossment as amended. The amendment is coded A24.
I recognize the member from Washington, Representative DePel.
Thank you, Mr. Speaker. This amendment would affect the amount that healthcare providers are reimbursed when records are requested from them. We don't want our healthcare providers to be losing money on this. Oftentimes it's onerous for them. They need to hire an administrative position simply to get records, and this can cost businesses a great deal of money. However, members have requested there be further conversation around this bill, which is appropriate. It should have a hearing in committee, and therefore I'll be withdrawing this amendment.
Representative DePel withdraws the amendment. There is an amendment at the desk. The chief clerk will report the amendment.
Zalesnikar moves to amend House Bill number 2435, the second engrossment as amended. The amendment is coded A9.
There are amendments to the amendment, but we'll allow the author of the amendment, the member from St. Louis, Representative Zalesnikar, to introduce the amendment.
Thank you, Mr. Speaker and members. This bill is one you've heard before. This bill provides options for women to support women. It's that simple. It's a bill that was in place prior to 2023 for 17 years. It was a bill that my predecessor, former Representative Mary Murphy, strongly supported, as well as fellow Democrats that are no longer seated here. This was supported for 17 years. This bill seeks to reinstate funding for pregnancy resources centers, funding for maternity homes. This bill, this amendment, allows for Planned Parenthood to be funded as it has been. It doesn't change that. Through the sexual and reproductive health grants, and it allows for the maternity homes to be funded through the pregnancy positive alternative grants. To me, it seems logical that if people are pro-choice, you would have more than one option. You can't be pro-choice if there's only one option for women. It doesn't make any sense. The very definition of pro-choice is a legal right to make decisions about your own reproductive health. It says whether or not to have an abortion or to keep the baby. This amendment simply restores what was an agreed upon bipartisan language for 17 years. And I've heard all the naysayers of why we can't do it, and I understand some of their situations, but the reality is since 2005, this has been a program that had audited oversight. The Wilder Foundation audited these facilities, went into them, inspected them, and there was bipartisan support to understand this. So, members, I urge you to support something that for 17 years, Democrats and Republicans in the House and the Senate supported. And if you're pro-choice, you're going to like this bill, because that's what went on for a lot of decades to ensure that women had more than one option. If they want to keep the baby or they don't want to keep the baby, this gives people the choice. And I hope that you will fund this and reinstate the dollars to the positive alternative grants. Thank you, Mr. Speaker.
There is an amendment to the amendment at the desk. The chief clerk will report the amendment to the amendment.
Purcell moves to amend the Zalesnikar amendment to House Bill number 2435, the second engrossment as amended. The amendment to the amendment is coded A30.
I recognize the member from Rice, Representative Purcell.
Thank you, Mr. Speaker. Firstly, I'd like to request a roll call.
Roll call has been requested. There are 15 hands. There will be a roll call. Representative Purcell.
Thank you, Mr. Speaker. My amendment is to increase the funding support for the Sexual and Reproductive Health Services Grant by $4 million. It's hard to fully share the impact these grants have had, providing education and treatment, especially for Minnesotans who may be miles from a full-service healthcare facility. We continue to see rural communities like mine losing access to services as rural hospitals and clinics continue to shutter. 37% of rural Minnesota counties don't have a sexual health clinic within the county at all. Thankfully, through outreach and education activities, in 2023, the Sexual Reproductive Health Services grantees reached 91,165 individuals across the state with medically accurate information about sexual and reproductive health, as well as where to access more comprehensive health care services if needed. My amendment restores $4 million to the Sexual and Reproductive Health Services grants, investing in the health of our state. It's a great investment. Every $1 spent on family planning services, medically accurate information in small group classes, or health fairs, that $1 translates to $7 positive impact in public health. In 2023, the clinics that received SRHS grant funding screened 16,000 clients for chlamydia. Chlamydia is the most prevalent sexually transmitted infection, and our young people are experiencing an epidemic across Minnesota. While 15 to 19-year-olds make up 6.5% of the population, they make up over 25% of the chlamydia cases in our state. Thankfully, this funding stream has been able to have a positive impact on this public health crisis. These grant increases increase the access to affordable testing, treatment, risk reduction, counseling, and condoms. The most recent grant cycle showed the annual demand for funding from the Sexual and Reproductive Health Services grant was $17 million. The difference between the request and the available funds was $5.6 million. Clearly, the need is still there. Adding this $4 million won't fulfill the entire need that we have in the state, but it would be an excellent investment in our younger and more rural Minnesotans. I encourage a green vote. Thank you, Mr. Speaker.
Further discussion to the amendment to the amendment. I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Mr. Speaker and members. I would urge you to vote no.
Any further discussion to the amendment to the amendment? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment to the amendment is not adopted. There is an amendment to the amendment at the desk. The chief clerk will report the amendment to the amendment.
Scott moves to amend the Zalesnikar amendment to House File Number 2435, the second engrossment as amended. The amendment to the amendment is coded A28.
I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker, and I'd like to request a roll call.
Roll call has been requested. There are 15 hands. There will be a roll call. Representative Scott.
Thank you, Mr. Speaker. This amendment to the amendment decreases the MA payment rates for family planning services by 20%, and this saves money, and so I encourage members' votes. Yes.
Point of order, Mr. Speaker.
State your point of order.
Mr. Speaker, under House Rule 3.21B, an amendment to an amendment must relate only to the primary amendment without introducing any new subject. The A28 introduces an entirely new chapter, 256B, and a new subject and medical assistant rates, which are not in the underlying amendment, so I ask that you find the A28 amendment not germane.
Any advice? I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. This has to be germane. We're on the health finance bill, and so members, I encourage a yes vote.
Further advice? I've studied the amendment, I've reviewed the bill, I've considered your advice, and then I'm going to rule that the point of order is well taken.
Mr. Speaker, I'd like to request, I would like to appeal the ruling of the Speaker and request a roll call.
Representative Scott appeals the ruling of the Speaker, has requested a roll call vote. Seeing 15 hands, there will be a roll call. Representative Scott.
Members, this is a very germane amendment to what we're talking about here today, and there's no reason to not vote to decrease this funding for 20% by 20%. It saves money, and so I request people vote against the ruling of the Speaker.
Further discussion on the appeal of the ruling of the Speaker. Recognize the member from Anoka, Representative Niska.
Thank you, Mr. Speaker. Members vote red to overturn the ruling of the Speaker.
I recognize the member from Hennepin, Representative Long.
Thank you, Mr. Speaker. I would encourage members to support the ruling of the Speaker. The test of the rule is not what we are discussing today. It is not whether the subject is health care. The test is whether the amendment to the amendment expands the scope of the amendment by introducing a new subject, which this clearly does, as you correctly ruled.
Any further discussion? Seeing no further discussion, I would like to remind members that a yes or green vote supports the ruling of the Speaker, and a no or a red vote will go against the ruling of the Speaker. The clerk will take the roll. The clerk will close the roll. There being 69 yeas and 64 nays, it is the judgment of the House that the decision of the Speaker shall stand. Now, members, we're on to the underlying amendment. I recognize the member from St. Louis, the author of the amendment, Representative Zalesnikar.
Thank you, Mr. Speaker, and I'd like to ask for a roll call.
Roll call request. There is 15 hands. There will be a roll call. Representative Zalesnikar.
Mr. Speaker and members, I urge you to consider this today. This is a bill that allows women to have the options to make the decision that they want to make. Just like I stated earlier, pro-choice implies more than one option exists. For women that want to keep their baby, that women maybe that want to keep it and raise it, keep it and give it up for adoption, or not. And right now we are funding one program for medical assistance, but we are not funding maternity homes for people to have a safe place to live on medical assistance, or pregnancy resource centers that give them a tremendous amount of support. It makes no sense to me how we can say we're supporting women and be pro-choice and say that when there's no options except one option for medical assistance. I would urge you, nobody's paying attention, it's clear, heads are down, but I'll tell you, for 17 years before the body was newly comprised in 2023, this went on for 17 years. There was truly choice and there was truly options for women. And I hope that I will keep at this until maternity homes are rightfully restored and pregnancy resources are rightfully restored. And I urge members to vote yes.
I recognize the member from Dakota, Representative Hanson J.
Thank you, Speaker. Members, I rose to talk about this issue once before, and I shared really intimate details of my own experience at a crisis pregnancy center, proving that crisis pregnancy centers do not stand for what they claim. Actual options include all options. Actual pro-choice means having access to all options. Freedom of choice means having that same access. It does not matter how you say it, because this bill explicitly removes a critical choice from people who are seeking services in these settings. And if this part of the bill weren't in here, because if you recall, I talked about this being the most problematic part of this last time, I would feel differently and be saying something different right now. But alas, the bill remains unchanged, unimpacted by people with lived experiences. Forced pregnancy is not pro-choice. Forced birth is not pro-choice. Forced adoption is not pro-choice. To be pro-choice, to respect freedom, is to support families. It's to support food shelves. It's to support our child protection system. It's to support good paying wages. It's to support paid family medical leave. It's to support earn sick and safe time. It's to support all of the things that we on this side are standing to fight for Minnesotans to support. That's what it means to be pro-choice and to respect the choices that every person deserves. So, if you support this, you support removing choice. You support not giving people access to everything that our state constitution and our state laws protect. You support giving money to people who will not give patients in crisis full access to the services they need. When you are pregnant and in crisis, it is among the scariest time of your life, and it is clear there are plenty of people in these bodies across the nation who have never faced that choice. I have faced that choice. Other people on this side of the aisle shared stories. I'm sure there's people over there who have faced this choice of looking for critical services and supports when they were pregnant and in crisis. And to offer this again without taking in the feedback of the very people who have had experiences of what happens when not just choice is taken away, but prejudice is expressed with taxpayer dollars. When people choose to insert their religious or philosophical beliefs into an organization using taxpayer money, that's a problem. Do not support this amendment. Once again, as a teen mother who should not be standing before you today because of the lack of services that these very centers did not offer me, that they sent me out into the cold, alone, as a child, pregnant, begging for help, do not give them more taxpayer dollars. Vote no.
I recognize the member from Meeker, Representative Gilman.
Thank you, Mr. Speaker. Members, what I see in this amendment is a reallocating of taxpayer dollars, taking money from MDH and reallocating it to another option. I'm going to tell you a story of a sweet lady that holds a special place in my heart. This young lady was 34 years old. She had already had, I think, 3 or 4 abortions, had lived quite a, she told me, a very colorful life. And because of her experiences as a young child and then her family situation, and being exposed to lots of things throughout her life, that was the option. An abortion was an option for her to continue to pursue her life. It's not one she's proud of, because her life at the time was prostitution, drugs, and alcohol addiction. So what she did is she found sobriety. She was living in a sober living home, and now she was living in a home and found herself once again in a situation of a pregnancy, an unplanned pregnancy. So she had her appointment and she was ready to go out the door to her appointment. And one of the gals right before she got out said, "Hey girl, stop. Don't go to that appointment. This is your ticket out of here to having your own place, to having your own way of life, to being able to do your own thing." And she stopped and she said, "No, the van's here, I gotta go." So she stopped and listened to her story a little bit, and she recognized that maybe she wouldn't go to this appointment today, but she'd learn more about what it would look like for her to carry her baby because she was sober. So she did make that choice. And through the process, her and the biological father made a very hard decision, but a very powerful and loving decision to choose adoption for this baby. They both had very troubling lives, and they were getting their lives back on track, but knew that choosing adoption for this baby was the best option. And yesterday, I got to celebrate Mother's Day with that 15-year-old girl. Now, has it been all that birth mom thought it would be? She did not realize that choice to listen to another option that day would result in her family growing, but also changing with us being now the adoptive parents to that baby. What I see this as is like literally anybody still has choices. This does not remove a choice. This adds choices. This adds ripple effect in the world. That firecracker daughter of ours that can, she's offered me growth and opportunity to see life differently because of her race, because of her experiences, because of her DNA, because of her strong will. That is so big, and I'm so grateful for the young lady that offered another choice. This doesn't strip away anything, but allows more opportunities for families to grow, for birth moms to be able to find support, and birth fathers. There's other things that we're doing here in the legislature that are pulling in birth fathers that may not even still be with the birth mom. So I strongly encourage support for this, again, because taxpayers in Minnesota want to see their money going for things that matter. The Gilman family's forever changed by this, and I strongly encourage a green vote on this. Thank you.
I recognize the member from Carver, Representative Nash.
Thanks, Mr. Speaker. I think we had an amendment earlier in this session that was similar to these same topics, where we were told that that crisis pregnancy centers are only one thing, trying to force people into one paradigm. And I got to tell you, I know a fair number of crisis pregnancy center people who volunteer or who run them, who fundraise for them. My wife and I have donated to them. And I will tell you that the comment was just made a minute or two ago that it is a philosophical choice. And you're right, it is a philosophical choice to fund crisis pregnancy centers, similar to the fact that it was a philosophical choice of the Supreme Court to rule in Doe v. Gomez. It is a philosophical choice that has been made to have the state fund abortion through medical assistance. And it was a philosophical choice by a bipartisan group of people back years ago that started it, and I think it was a very good thing to say here's the philosophical part, if state money is going to, through MA, fund Planned Parenthood, we should also say that we recognize and agree and promote that there may be an antipodal viewpoint, another viewpoint, and that is to keep the child, to possibly put it up for adoption. Those are two different philosophical viewpoints, but one of them is only law today. The other was yanked out of existence during the last biennia. We should fund this. Representative Zalesnikar has a great amendment here. She had a great bill when it was on the floor. The idea that it's okay to fund one paradigm and not the other is just wrong. Keeping life alive is a worthy and notable and noble thing to do. It's a simple thing. Put it back into existence like it was for years, that had DFLers that supported it, like Representative Zalesnikar said, and you move along your way. But the argumentation against this presupposes that only one philosophical argument as it relates to state funding of something relating to pregnancy is to terminate the child. And that is faulty logic. Members, I support the Zalesnikar amendment, and I hope you do too.
Further discussion. I recognize the member from Lyon, Representative Swedzinski.
Thank you, Mr. Speaker. Thank you, members. Thank you, Representative Zalesnikar, for this amendment. You know, it's an interesting time of year. I'm sure most of the members here spent the weekend celebrating motherhood, celebrating graduations, eating ham sandwiches, potato salad, coleslaw, chips, or a pulled pork sandwich. And I was reminded, as this debate began, about the A9 amendment, this debate. And a number of years ago, out on the campaign trail, I met a woman who, about this time of year, had received one of those graduation invitations. And oftentimes it's, oh, this is the Johnson kid, or this is so-and-so's nephew, or this is the neighbor up the road. And this woman, her name's Judy, we'll just use a fake name to protect her, but Judy received this graduation invitation. And she said, hey, I'd like to show this to you. And on the invitation, it was probably about 40 miles from where this woman lived. And on the back, on the front, it said, hey, I want to welcome you to come to our graduation. I'd really love it if you could come. You've paid a big part of my life. And it said over on the back side. She was like, I really didn't know who this woman was, Judy said. And on the back side, it said, 18 years ago, Judy, you had a conversation with my mom. And my mom was 17 or 18 at the time, didn't know what to do, but through one conversation, because of you, I'm here today. And I want you to come to my graduation. I've never met you. The last time my mom spoke to you was 18 years ago, when she left the building and made a choice to have me. If that doesn't send a shiver down your spine, it certainly did mine. When Judy shared that with me, I thought about, you know what, that's what this is, right? We may not agree whether you should be pro-choice or pro-life, but we can agree that a conversation is always worth having, regardless of the side of the issue that you happen to be on. And we're not debating right now whether or not we're funding abortion. This amendment, thank you, Representative, for carrying it, is about whether or not we can have that conversation. Whether we take the thumb of government and press it hard on the scale of one side of the conversation. We're just saying, if there are other voices, do they not also then deserve a little bit of that funding for their conversation as well? So as you contemplate whether or not to vote for this amendment, I'd ask you, is it worth a conversation? Is it worth an unsolicited graduation invitation? I would say yes. I would say support the amendment. I would say push green for Judy's friend. Thank you.
Any further discussion on the amendment? I recognize the member from St. Louis, the author of the amendment, Representative Zalesnikar.
Thank you, Mr. Speaker and members. I think this is worth a conversation. I think if either is removed, whichever side you're on, it certainly changes the playing field for a woman to have options. That's all it's about. It's not mandating anybody to do one thing. It's not mandating people to choose a perspective that may come from one person or a perspective from another. What it's doing is giving women the support they deserve. In 2025 in the state of Minnesota, that we would support women and meet them where they're at and fund these through medical assistance in a reasonable way, listening to the conversation from both sides of the aisle. Minnesota expects nothing less, to be honest. And whichever side you're on isn't the point. It's not about us. It's not about us as politicians. It's around the people we represent. And who are we to say what decision and option they want? I would think they want more than one option to have a choice. That is something that is logical to me. If your choice was removed and the only one that existed was this side of the aisle, it would be problematic for Minnesotans. And if this side was removed, it's problematic. And therein lies the issue of why this amendment is here today. For 17 years, House Republicans and Senate respected that. Respected it for women to have choice. That's it. It was that simple, and it didn't have to be debated. And I wish it could go back to that, and I hope that someday it will, and I hope it's today. I hope we put green up to have both sides of this conversation, to have the medical assistance funding it deserves for women to truly have support and have choice. Please vote green. Thank you.
Seeing no further discussion on the amendment, the clerk will take the roll. The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Nadeau moves to amend House Bill number 2435, the second of Grossman as amended. The amendment is coded A14.
Recognize the member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker and members. This is probably the most political amendment today. It has to do with optometry scope of language. Members, for those of you who, I think what's political is we're talking about, intravitreal and subtenons, injections. But in all honesty, this bill has been in front of us for a number of years. For those of you who weren't here last year, we passed this bill last year. It was included in our scope of practice bill. It was Article 8. It was one of the few bills that Representative Liebling let me work hard on, and I really appreciated that. And there was a bunch of scopes in that bill, and we passed it. We went to conference committee. It was also one of the few conference committee reports that were signed by all members on the Senate and in the House. And then Article 8 fell apart because of politics. And so we shouldn't have politics in scope of practice bills. And I brought this amendment today because I was told that our policy bill, our health policy bill, which is a really good bill, is kind of being held up. And so I'm super happy to hear Representative Long say we're scheduling this bill to be heard on Thursday. And with that, I would like to withdraw my amendment. Thank you, Mr. Speaker.
Representative Nadeau withdraws the amendment. There is an amendment at the desk. The chief clerk will report the amendment.
West moves to amend House Bill number 2435, the second and Grossman as amended. The amendment is coded A12.
I recognize the member from Anoka, Representative West.
Thank you, Mr. Speaker. The A12 amendment is answering a big issue that we have heard, all of us have heard really, if you've been talking to your counties, and that's about the implementation of the Minnesota African American Family Preservation Act, otherwise known as MAFPA. This particular amendment takes some language that we discussed in the Children and Families Committee and will allow us to go into conference committee with a position on MAFPA. It's nothing about repealing, it is merely a delay. And what it does is metro counties that haven't already started implementation have a one-year implementation date put back. Then counties that house regional centers, so that's defined in this amendment as cities of 70,000 or more, those go into effect and have to implement it 1 year after that. And then after 1 year after them, goes for the entire state. And this will buy us time both to develop some fixes, because there's a lot of concern that the counties have with how much this is going to cost, and it gives us the ability to provide some relief when we're putting a lot on our counties. Our counties are definitely going to experience some cost increases in many different areas, from bills we pass, from what the federal government does, and just from economic situation in general. Delaying this is critically important to ensuring we don't have an even worse economic situation that will naturally be pushed onto property taxes and increase taxes on pretty much every single Minnesotan. And that's outside of all the other budget constraints we're seeing. So I would urge members' support of this A12 amendment. And if we are able to pass this and bring this on, I think it'll be very important because we'll have a position in conference committee. And I'm happy to work with the other side of the aisle on what that language should look like when it returns, because we need something. Our counties need something. So a vote for this A12 amendment to put it on does not mean this is the language that's going to come back in conference committee. But it does give us the opportunity to make some adjustments, which right now, what we're seeing in all these bills is we make no adjustments to this program. But I know every single person, likely, in this chamber has heard from their counties that this particular provision is going to be tremendously expensive. And unlike the 2 counties that are currently implementing it right now, there's no money for the other counties to do so. So delaying it gives us a chance to address the concerns of our counties, refine the bill, make it effective and not a drain on our county coffers that will result in tax increases for pretty much every Minnesotan. So, members, I would urge your support, and if this goes on, I think we can find a way to accept other amendments as we work our way through this process to bring this bill to conference committee. And, Mr. Speaker, I would request a roll call.
Are there 15 hands? Seeing 15 hands, there will be a roll call. I recognize the member from Hennepin, Representative Agbaje.
Thank you, Speaker. I am in opposition to this amendment. This amendment is premature, and it will disrupt the efforts of the current phase-in program that is currently being conducted by Hennepin and Ramsey counties. This amendment continues the pattern of saying that some children and some families count more than others, and now we're saying it's based on where you live. By doing a staggered geographic delay with no additional metrics, and without clearly identifying the data necessary to collect during this delay, this amendment would set this program on a track to not be implemented. Both Hennepin and Ramsey counties do not see the need for delaying this program. As phase-in counties, they are 5 months into doing the work and gathering the experience, the data, and the recommendations to prepare the remaining 85 counties on how to implement this program. They have been working groups to aid in that effort as dictated by the law that we passed last year, which I would say we did pass unanimously on the first try. The program will also be issuing a report on the 1st of January 2026 to let other counties know what they may need to implement the program. And I've spoken with the agency, and they also would like to see the program continue without interruption at this time. And I do hear the concerns from people in some counties that are worried or scared that they may not have the resources or ability to implement the African American Family Preservation Act. And I understand that. But I would recommend that those counties engage with the working group, reach out to their colleagues in Hennepin and Ramsey, and ask questions so they can be prepared ahead of 2027. I would urge members to let this program work. Let the law do its job, and let the benefits come to families who need that extra care and support to keep their families whole. So I would urge members to vote no on this amendment.
Any further discussion to the amendment? I recognize the author of the amendment, the member from Anoka, Representative West.
Thank you, Mr. Chair, and I tried to make clear in my comments, if establishing metrics or data to collect would be the difference, well, I guarantee you it's going to take consensus to bring it back from conference committee, and I think, actually, that's a great idea. We should refine what we would be looking for if this were delayed. I think that'd be a tremendous value. So, I mean, I would be happy to commit to including those things in conference committee when we work with the Senate, who does not have this provision. Genuinely so. My concern is that we've had basically every county of the state tell us this is going to be a huge, huge problem. So members, I would urge support of the amendment, and to the other side of the aisle, I am happy to work with my co-chair to make sure your concerns are represented in whatever would come back from our conference committee. So members, vote green.
Seeing no further discussion on the amendment, the clerk will take the roll. The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Coulter moves to amend House File Number 2435. The second of Grossman as amended. The amendment is coded A8.
I recognize the member from Hennepin, Representative Coulter.
Thank you, Mr. Speaker. I'd like to request a roll call.
There are 15 hands. There will be a roll call. Representative Coulter.
Thank you, Mr. Speaker. So I have a button on today that says, and I want to make sure I get the words right, I'm at work today because I have childcare. And I think it is a real and increasing strength of this body that there are actually more and more of us on both sides for whom that is true. And I am confident that if we didn't know before the pandemic, surely we know now that our child care providers truly are the workforce behind the workforce. In fact, I would go so far as to say that there are two types of people in this world. Those who know that they depend on child care to get by, and those who don't know that they depend on child care to get by. I know that we all believe that our child care providers do the Lord's work. And I am sure that we've all heard from providers and parents in our communities about the reality of the crisis that child care is in. Now, there are a number of individual factors, to be sure. But honestly, a lot of it just boils down to the fact that child care providers are paid way too little. It's really small wonder that it's hard for families to find quality child care that's affordable when the educators who work there, and to be clear, they are educators, when those folks can make more money working at Target and probably get thrown up less on too. And so among the other really important work that we did in our budget 2 years ago related to childcare, we created the Great Start compensation supports. These are dollars that go right to child care providers who are directly caring for kids for better pay and benefits. And in fact, we went a step further by recognizing, as is always the case, that this crisis hits certain communities harder than others. In creating the Great Start compensation supports, we specifically said that providers who serve families on public assistance, providers who serve communities where it takes longer to get from point A to point B, where poverty is high and incomes are low, where unemployment is high and home ownership is low. The folks who serve our most vulnerable and in-need kids get a small bonus. This reflects the reality that the need for childcare is hardest to provide where families are most in need. Now, I don't know why, but this bill cuts that bonus. To be clear, nixing this bonus for childcare providers will not save the state any money. I doubt it will really even extend the dollars for the Great Start compensation supports all that much. What it will do, members, what it will do is spread that money so that folks doing better get more and folks who aren't get less. So I'm asking for your support for the A8 amendment.
Further discussion to the amendment. I recognize the member from Anoka, Representative West.
Thank you, Mr. Speaker, and thank you, Representative Coulter, for bringing this amendment. Now, I oppose this amendment for a number of reasons, although my mind was able to be changed a second ago. Number one, this program, the way it's funded, it's going to run out of money. It's designed to run out of money. And what I mean by run out of money is the current stipend that the child care workers are receiving is going to go down from the number it is today, guaranteed 100%. Why is this? It's from some budgeting that I really think we should stay away from. There is a baseline budget for this program that has a consistent $129 million a year to pay for each child care worker to get a bonus if they're part of the program. Now then, in current law, there's a 10% equity bonus. And you know, when you hear the word equity, you know, it gets both parties very hot and bothered both bases in particular. And really, when you hear equity, you mean it's going to be unfair. It's not going to be equal. And if you work in one of these areas, you get 10% more than another child care worker in this bonus from the state. Even though you both pay the taxes, one gets 10% more. And we already have a litany of public assistance programs and child care assistance programs that are targeted based on income. We don't need to put that into the Great Start Compensation Program. I think the program should treat child care workers equally, because I think every child care worker is valuable. Almost every, with 2 notable exceptions. So it has been frustrating to see that the program's designed that these child care workers are going to see their compensation from the state go down, and they're likely going to blame their employer, even though it's the legislature that set up this program to run out. So eliminating this 10%, as the bill does currently, will help extend the program, will help ensure more people, there's more money for more people for a longer period of time, and it also would treat people fairly, treat people equally, because I don't like the idea of treating child care workers differently. We should, on the other end of the cycle, yes, we should target our support for people with lower incomes to actually have their children be cared for without completely bankrupting them. But we shouldn't do that on the backside. And lastly, this is a continuation of a federal program, a temporary federal program, a temporary COVID federal program. And the feds have a little bit of an advantage over us in this Minnesota House. They get to print their own money. They don't have to balance their budgets. Unfortunately, we can't print our own money here in Minnesota, and we have to balance our budget. So continuing a massive, expensive program like this already puts a lot of strain on the current system. So removing this equity bonus component is just a small thing that will ensure child care workers are treated fairly, they're treated equally, and they'll get the same amount of money for longer, a little longer. But the program, this bill does not fix the fact that the one-time money is going to run out, and then it's going to be significantly lower payment to all these child care workers. This is an amendment that would ensure that they're not treated fairly, and that they are going to see their stipend, their checks, their bonus from this Great Start Compensation Program go down sooner rather than later. So, members, I would urge a red vote on this amendment.
I recognize the member from Ramsey, Representative Pinto.
Thank you, Speaker. And members, I just was prompted to speak by the reference to the equity language, because I can understand, Chair West and others, that may cause some provocation for folks, and that's just why Representative Coulter's amendment is so carefully drafted. And you'll note what it does is it identifies these areas as child care deserts. And I guess I'd ask members, but especially my colleagues on the GOP side of the aisle, do you represent a child care desert? Because I bet most of my colleagues, in fact, do. These are places where it's extremely difficult to get access to early care and learning. I'm assuming you're hearing about this from constituents, from employers, from community leaders. What the Great Start Compensation Supports do is that they recognize this is a public good. It's the workforce behind the workforce. Looking at my colleague, Chair Baker, these early care and learning workers are. That's true in the immediate run so that parents can work, but in the long run, so we have kids get off to the great start they need so that they can work and be productive citizens in the future. So in any case, we recognize that the economics of this sector do not work. They just don't add up. Happy to talk to you further about it. And so we're recognizing is trying to provide some sort of bump. But what the Great Start Compensation Supports do is recognize that they're in fact child care deserts. And so if you are concerned in your community that you may have a desert and you would want to make sure that there is some extra incentive there, that's what the underlying law does. This amendment would reverse that and actually say for those of you who represent a child care desert, there'd be less support for those workers. The final point is you're absolutely right that there is a cut in this program, unfortunately, going forward from where it's been the last 2 years. That is unfortunate. That will have ripple effect for many years to come. I hope that over time we will be able to recognize this as the public good even further and that it is and put more public investment in. In the meantime, though, I think recognizing the child care deserts need some additional support makes a lot of sense. I would urge a red vote. Thank you, Speaker.
Further discussion of the amendment? I recognize the member from Morrison, Representative Schultz.
Thank you, Mr. Speaker. And I'm having a hard time because in central Minnesota, it's one of the top places in the state that faces challenges with childcare, but mostly because of onerous government mandates and things that come and happen and have happened, whether from this body or whether from state agencies that are frankly run amok and out of control, because that's exactly what we've seen. And now we have a brand new Department of Children, Youth, and Families. And if we haven't seen, it is included inside of this bill. We have a budget for that agency that is something like $2.2 billion. And that's just for one biennium. And if you were, like I am, a family that has a young baby, and if you were to consider the number of families in this state that have children under the age of 5, you might get a grand total of somewhere around 330,000 families. That would be on the high side of some data that we do have. And frankly, we probably need more accurate data with the total number of families under 5. But then, members, the most concerning thing to me is that when you consider that we have a $2.2 billion budget for this area, if you were to divide that out by 330,000 families, you would get $3,400 per year or $6,800 over 2 years. That's the cost of government. The cost of government. Because families like mine and the other 330,000 families across the state could see that kind of money. Now, I understand there's some additional government programs that, frankly, my family probably doesn't qualify for. And certainly we want to take care of those most in need in our state. But let's consider the immense cost of a brand new state agency when we're talking about childcare deserts that aren't solving the problem in my community. So why do we think that this language or additional money into this area is going to solve the problem? Especially when you have a state agency that is promulgating new rules to make it more difficult to do business. These things don't work. Vote no.
Any further discussion? I recognize the author of the amendment, the member from Hennepin, Representative Coulter.
Thank you, Mr. Speaker. Before I get to sort of the meat of my closing, I think we should just be really crystal clear here, particularly as we gather on the day after Mother's Day. When we hear a cry from some corners that we need to have more babies, at the same time that we are cutting the supports and services to care for them, we need to expose the hypocrisy of anyone claiming to be pro-family when the only thing they are pro is forcing parents, and to be clear, almost exclusively moms, out of work with nothing to show for it. Now, I understand there are some folks in this room who maybe don't want to take my word for how important these payments are. I am not a child care provider, at least not one who gets paid for it. I don't live in any one of your districts. So I thought I would share what some actual child care providers who do actually live in your districts say. Michelle from Cloquet says, please reconsider taking the additional 10% from centers like mine. Without it, I do not know if I will be able to continue to remain in the field. Danielle from Duluth, the additional 10% in support has been a crucial factor in helping us move toward more equitable wages for our staff, professionals who are essential to the growth and development of the children in our care. Taylor, also from Duluth, without the additional 10% in Great Start support payments my program receives for caring for low-income families, I worry for my future in the field. I am barely making ends meet now and cannot afford to take any further cuts. Jessica from Blooming Prairie, without the additional 10%, I would need to place all my staff on a salary freeze and will need to let go of 1 or 2 of my high school students. This change would cause additional stress on my full-time staff as these students are essential to our classrooms to provide some afternoon respite. Lynn from Bemidji. 10% may not seem like much to many of you, but to the child care centers across the state who receive it, it is the difference between having 20 teachers or 21 teachers, which can translate to the difference between having 3 classrooms or 4 classrooms, which can translate into the difference between being able to serve 40 kids or 50 kids. Chantel from Mountain Iron. Without this payment, we would be in danger of cutting program hours or even closing our doors. Teresa from Byron. Penalizing the programs that support Minnesota's most vulnerable families sends the wrong message and creates more inequity in an already strained system. These are child care providers in your own communities who serve your neighbors, telling us not to do this. Axing this bonus will mean fewer people to care for our kids and a tougher go of it for the ones who stick around. And folks, I have more stories. If I can pick them up. Sheets and sheets of them. No one goes into childcare to get rich, but they shouldn't be forced to take a vow of poverty either. So in closing, I just want to recenter what we really are talking about here. We are talking about a crisis, a full-on crisis in childcare. How many times in the Children and Families Committee have we heard about how many slots, childcare slots, we're losing all over the state? We are talking about a crisis in caring for our littlest littles. And I said it this morning, and I'm going to say it again because I don't think we can hear it too often. 80% of brain development happens by age 3. 90% happens by age 5. And those of you like me who have little kids in your life, you see it right before your eyes every single day, and it is the most remarkable thing. Especially when we're talking about making a difference in the parts of Minnesota where folks need it the most. What could be more important? Thank you.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Hicks moves to amend House File Number 2435. The second engrossment as amended. The amendment is coded A5.
I recognize the member from Olmsted, Representative Hicks.
Thank you, Mr. Speaker. Autism is part of neurodiversity. It's a spectrum that in the last 15 years has added lots of new folks to it. People who used to be categorized under Asperger's or nonverbal learning disabilities. Autistic folks have a variety of strengths and a variety of support needs. They aren't a monolith. They are a diverse group of our community. They are little itty bitties being diagnosed now as early as 9 months due to new research, and adults aging in place. We should be listening to the autistic community about what the supports they think would help them look like. And we should be talking about how to invest in what they need. We should always be working to ensure that people have the opportunity to consent to any research or registry that involves private healthcare data. My amendment today was designed to protect that right. However, given conversations I've had with others, I'm going to withdraw the amendment today, but I would ask that we all consider how we would be impacted if we had no opportunity to consent.
Representative Hicks withdraws the amendment. There is an amendment at the desk. The chief clerk will report the amendment.
Senator Murrah moves to amend House Bill number 2435, the second Grossman as amended. The amendment is coded A7.
I recognize the member from Hennepin, Representative Senator Murrah. I recognize the member from Hennepin, Representative Senator Murrah.
Thank you, Mr. Speaker. I rise to offer the A7 amendment. So this amendment is building on the conversation we have been having about childcare and childcare workers being the workforce behind the workforce. All of us are here today because not all of us, but many of us are here today because we have childcare. It's what allows us to do this work. And if we are not able to raise wages for childcare workers, the least we could do is make sure that they have affordable childcare for their own children. The reality is that many of our childcare workers are making poverty wages, and so many of them are actually on the waiting list for our early learning scholarship program, which means that we have childcare workers who are making poverty wages of, for a family of four, less than $60,000, which is 50% of the median income. So I wanted to offer this amendment to illustrate the need that we have childcare workers who are on the waiting list for early learning scholarships, who they themselves are not making a living wage to be able to afford childcare for their own family members. But the reality is that with our limited budget in this committee, I don't think it is right to siphon off some funding for a certain group. I really just want to make the point that we should be expanding our childcare subsidies across the board, including our early learning scholarships. And so I am going to withdraw my amendment, but I do hope that this conversation about childcare for childcare workers can continue. I have heard that Chair Pinto and Chair Baker are both committed to having this conversation continue potentially in the Jobs or Workforce Committee. And so with that, I will withdraw the amendment at this time.
Representative Senator Murrah withdraws her amendment. There is an amendment at the desk. The chief clerk will report the amendment.
Pinto moves to amend House File number 2435, the second and Grossman as amended. The amendment is coded A11.
I recognize the member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, the A11 closes a loophole that is, closes a dangerous gap, I should say, in our maltreatment statutes. I do have a handout that I hope is being distributed at the moment. I guess it is. Okay. Thank you much. Members, at the moment, if there's any report of maltreatment for a child, and that report can be taken by and needs to be taken by the county social service agency where the child lives, but that report may not be investigated if the maltreatment happens outside the state. The material being distributed to you is from the Minnesota County Attorneys Association. This is a very high priority of our state's county attorneys. You will see in the material being distributed to you at least 4 examples from Sherburne County, from Dakota County, from Hennepin County, from St. Louis County, of situations where children were abused or molested outside of that county. A report was made. In some cases, actually, an investigation did occur, and there was action attempted to be taken. And then a court found, nope, there's a gap in the statutes that prevent the investigation from happening and from the appeal being made. You'll notice one of the situations, I believe it was in Sherburne County, I may be misremembering that, and with me. I'll get it dropped off in a second myself, I'm sure, where the person involved was found to have committed abuse. There was an attempt made to say this person should not be with vulnerable children any longer, and guess what? That was overturned because, in fact, there was not the legal ability to address that. The language that you're going to see in this statute, in this amendment, passed out of our Judiciary Committee, It passed out of the Children and Families Committee, been approved by both of those committees. This is language that is paralleling language in our other child protection statutes. It just so happens to be a gap in the maltreatment of minors statute. So again, reports can be taken, can't be investigated. Can they be criminally investigated where they happened? So if the family's on vacation in Florida, as in one of these cases, there's molestation in Florida, can it be investigated in Florida? Yes, it can. But then for criminal investigation, but that's quite different from a child protection investigation, cannot happen. So members, I would urge your green vote on the A11, and thank you, members.
I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. And Representative Pinto, I know this is a well-intentioned amendment that was a bill this last session, and it came to the Judiciary Committee, and I don't believe we passed it. I don't remember for sure, but there are some jurisdictional questions on this bill and how it would actually work out, where we're trying to prosecute, or we're not really prosecute, it's because it's not done in the courts, it's done through the executive branch here. But how we are going to handle a case where there may have been some abuse in Dubai or in Florida or some other jurisdiction outside of the state of Minnesota is really pretty murky. This is not ready for prime time. And in a lot of cases, there are ways to go through a similar process now. So folks, I just think this is unnecessary and it's not ready for prime time, and I would encourage a no vote.
Further discussion to the amendment? I recognize the author of the amendment, member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. I would at this time request a roll call, Mr. Speaker.
There are 15 hands. There will be a roll call. Representative Pinto.
Thank you so much. Yeah, and Chair Scott, I appreciate those comments. I will say this bill was approved by your committee. It was approved on March 18th. I've got the minutes right in front of me here. Also approved by the Children and Families Committee. It's true that in both cases there was discussion. I received a number of questions from members. I believe I answered them adequately. I certainly did well enough to have members vote to approve the bill. It's our state's county attorneys that have developed this language. They're the ones who deal with murkiness. They're the ones who have identified that this is language that is needed. I really would urge members to look at each of these cases, the one in Dakota County about the family traveling to Florida for vacation. If you've got a stepdad, as in that situation, who molests a child, and those allegations are reported to police and social services, as was the case in Dakota County, one would certainly hope that there could be action that could be taken, including a finding of maltreatment. In that case, actually, the county social service tried to, and the court reversed it. Again in Sherburne County, again in Hennepin County, again in St. Louis County. Members, this is actually pretty straightforward. It's not that complicated. Counties investigate reports of child maltreatment. They do so in their county. If there's a cabin in the next county over, or something happens in the next county, the county needs to be able to investigate that. At the moment, they cannot. This is, as I say, one of the highest priorities for our state's county attorneys. Members, please don't vote this down. Vote in favor to be sure that our child protection workers, that our county attorneys can go after abusers and make sure to protect children. That is the question before us today. Please vote green.
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. I'm sorry to speak after the author of the amendment. I had risen and wasn't recognized, but I just wanted to correct the record. Chair Scott, I respect you so much, and so many things have gone through our committee. It's no wonder you don't remember every single thing, but in fact, we did pass this bill out of our committee. And I do remember that we did have some discussion. Members asked really good questions, but at the end, we did pass the bill. And I would really urge members to support this amendment. I think this is a really important issue. And, you know, while I know that here on the floor, when people maybe are hearing about it for the first time, it might be a bit challenging. But our committee really did consider this and pass it. And as everybody knows, unless there's bipartisan support, nothing passes committee. So I would urge members to support the amendment.
I recognize the member from Hennepin, Representative Katiza-Watun.
Thank you, Mr. Speaker. And I also apologize for speaking after the amendment author, but the speaker is much taller than I am, and so sometimes, yeah. So, members, this bill, Chair Pinto's bill, has tremendous bipartisan support. I'm going through the committee process, and I actually support this bill. I think that, when we talk about taking care of children in the state of Minnesota, we need to make sure that we're not just checking that at the border. And so if children travel outside of Minnesota and they come back and have undergone a traumatic experience, we need to make sure that our child protection workers, our public safety officers can do their due diligence and move toward a resolution for these kids. So members, I would ask for a green vote.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 75 yeas and 58 nays, the motion prevails and the amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Liebling moves to amend House File Number 2435, the second engrossment as amended. The amendment is coded A13.
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. So members recall that this is the bill that did not get marked up in committee. So you're going to hear a little bit more about an issue than maybe you normally would if we had had the time in committee to have the discussion. But this amendment, well, let me just start by saying, in this state, over many years on a bipartisan basis, we've been working to improve the dental care that is available to folks under our public programs. We know dental health is an important part of overall health, and regular dental visits are essential to dental health. And that is why we include dental services for both children and adults in our public health programs. And by the way, the feds don't require us to include adults, but we do. But if you were, let me just say that most of us, all of us, I assume, have been to the dentist. And I would venture to guess, I'm not going to ask for a show of hands, but I bet that not too many of you would be okay with never getting any preventative dental care or getting no dental care in a year. I think most of us get at least one dental cleaning and checkup in a year. And certainly, we would not be okay with our children or grandchildren never getting any dental care. But if you were on medical assistance or our Minnesota Care program, even though you have a dental benefit, chances are that you would not see a dentist. You would not be able to see a dentist, even though it is actually covered. Members, the system we have right now for providing for the coverage of dental care does not work. Even though we all understand how important good dental care is to overall health, and that dental care is really relatively cheap, preventative dental care isn't all that expensive, In our current system, about 60 or 65% of the folks who have this coverage never actually get a dental visit. We have spent many hours as a legislature over the years discussing this, and it's been a bipartisan concern. I remember even when now Senator Gruenhagen was in the House, and he was on the Health Committee for many terms, I think. We used to discuss this endlessly. Why weren't people getting the care they needed? How could we improve this? Because let's face it, all of our constituents are impacted by this. In fact, one of the very first times, I probably maybe shouldn't even say this, now I know everybody will listen, but one of the first times I ever talked to Representative Smith, he was my constituent. One of the very first time, maybe the first time I met him, he asked me, why is dental care so bad under our public programs? And I said, I know it's bad and I'm working on it. And I was telling you the truth, wasn't I, Representative Smith? Because I was working on it and I still am working on it. Because it just isn't right and it's not smart either. So we have spent many hours on this. We raised dental rates, we expanded benefits, but there's still been very little progress on the basic issue of getting people to be actually able to have a preventative dental visit, which they so badly need just to maintain their dental health, a very inexpensive thing. So in 2021, when there was a Republican majority in the Senate and a DFL majority in the House, we finally decided that enough was enough if we couldn't get improvement. And in that year, on a bipartisan basis, we gave the insurance companies 4 more years to improve access to care, with DHS monitoring how well they were doing and negotiating improvement plans if they didn't hit a benchmark that we set. So then we raised payment rates, we made it simpler for dentists to enroll in our program in hopes that this would all help. But at that time, 4 years ago, we wrote into the law that if after 4 years, at least 55% of enrollees were not getting even one annual dental visit, that the state would go to a different system. We would hire one dental administrator to run the entire program and still running it through all of the different insurance companies that we use. And let me just say that each of those companies, sometimes we call them managed care organizations. They don't really manage care, they manage money, but they each hire a dental administrator to run their program. So now we have state money going to insurance companies who hire another company to administer the dental program. So 4 years ago, we put in law that if there wasn't enough improvement after 4 years, that we would then go to a single dental administrator for the state. This was not an enormous change. It was a bipartisan change. All it does is streamline the administration of the program by hiring one administrator. And DHS has put out the RFP and has settled on Delta Dental as the single administrator. So we are not talking about going to some strange different program. We're just talking about having one administrator administer the program instead of 7 different ones. In the bill that we're voting on today, in the health bill, there are actually a couple of provisions that do something similar. This is not a really strange, radical thing to do. It's just trying a different thing. And let me just say that I believe we waste a lot of money in our public health programs. And I know all of you agree with me, but we don't all agree on how that money gets wasted. And it probably gets wasted a lot of different ways, but one big way is through layers of administration, that we pay for all kinds of money management instead of paying for care. So in this bill before you, there's a single PBM in the bill, and that is supposed to be saving a lot of money in the bill. There's another one where there's a carve-out of our non-emergency medical transportation. It was a governor's proposal that's in there because it's supposed to save a lot of money. But But already in law, for the last 4 years, has been this provision to have a single dental administrator take over the dental program. Now, the current managers of the program, the companies, the insurance companies, have had the 4 years to do this. Members, it has not improved. There are statistics that are available to everyone to look at that are on the website for DHS, and I could give you the website, but there's a nice dashboard. Now, they are a little bit behind. You know, the data's never up to date, and so the last data is for 2022. But you can look at all of this. The statistics have not improved. This is the most basic kind of thing. Are people actually getting the care that we are paying for? And the answer is many of them, more than half of them, are not. So my question to you is, isn't it time? Isn't it time to just try something a little bit different to see if we can do better? This is not a radical idea. Just to have one administrator, Delta Dental, it's been around a long time, private nonprofit, to be the one contractor for us so that we can have a better view into what they're doing with the program, so that we as legislators can be more in control of the policy levers to improve what's going on in the program. So this is what is in law. Now, the underlying bill here changes that. And this is my amendment is going back to, mostly back to what is in law already. Because what is in the bill before you pushes off the date for 2 more years, so that would be 6 years total. I mean, how long do we want to keep doing the same thing over and over and over before we say it's not working? So not only does it push off the date for 2 more years, it puts in place an advisory committee, and this task force, I guess it is, and the task force is tasked with figuring out all these things that are problems in the dental program. Well, members, we've been trying, and people have been trying to figure out how to make everything really great for a long time. You know, on this House floor, in this body, we struggle all the time with how to get more people into the pipeline for different professions, how to make payment rates, how to get payment rates really fair and really working well, all these kinds of things that we struggle with. What the underlying bill here does is it sets up this task force, including the managed care plans, which, by the way, why would they want to help? You know, these are the insurance companies who stand to lose the program because they can't do it. They're included in this. And then it has this group is supposed to kind of figure out how to make the whole dental program really great and really work. And then the Department of Health is supposed to tell us all how to implement all of the things they recommend. Well, that's not going to happen. We can't wait until we have everything perfect before we even make a single change to help us as legislators be able to see what's happening in the program and be able to have more influence over it. So I have a number of problems with what's going on in the underlying bill. My amendment, just so everyone understands, my amendment is taking out most of what's here, taking out what's here in the bill, going back to the underlying law, which is that they got the 4 years, and it's enough. And then my amendment also has a provision in it that would take these savings from carving out this program and channeling it back into the rates. So this is also intended to help, because one of the real concerns about what's in law right now is that it takes it back to the fee-for-service rates, which in some cases are probably lower. So my amendment takes care of that by channeling all these extra costs back into the rates to raise rates further for providers. But we know that, you know, for those of us who've worked on healthcare, for those of us who've even been in this body working on anything, you know, it's not ever once and done. We have to keep working on these things to try to improve them. So the idea that we can't make this small change until we get to perfect is really just means that we're going to keep doing the same thing over and over again, wasting money on something that is not working. And I don't even know how much money we're wasting. We don't even get that accounting. So it's really important that we pass this amendment. Mr. Chair, Madam Speaker. Madam Speaker, I'd like a roll call, please.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Liebling.
Thank you very much, Madam Speaker. So, members, if you look at what is in the bill, so that's just one area where I have real concern about the bill. The other thing, I don't know how many of you were here when some years ago when we had a lot of conversation here on the House floor about a bill that was passing with dots in it, with blanks. I see, Madam Speaker, you're smiling. You remember that? Yeah, a lot of conversation. Well, this bill before you, members, has blanks in it. It has blanks in it. So if you look at page 107 of the bill, it has blanks in it. And the blanks are, so there are several blanks in it, and the blanks are dates by which this wonderful committee is supposed to come up with all the answers. And when the commissioner is supposed to come up with its big report that tells us how to fix every single thing in this program practically. And of course, I'm overstating it. But, you know, so this is a very problematic provision that's in the bill on a number of levels. This can be worked on in conference, but it would be better worked on if the language here was not the language coming from the Senate. And so it would be really good to take this out of the bill, so pass my amendment, so that we can actually have some discussion about going forward, making sure that the dental rates are sufficient, but also not waiting another 2 years or more and just doing the same thing over and over and over again while your constituents who are on these programs, who are counting on you, never get a dental visit. Now, I'm going to pull up I know I'm talking a long time here, and I usually don't like to do that, but this is something I'm really very passionate about, obviously, because 4 years ago, we negotiated this, and now it's like, oh no, it's not good enough. We've got to wait another at least 2 years. You know, are we ever going to make a change here? I want to direct your attention to the website. And so it's on the DHS website. It's Medicaid-Matters/oral-health. And there's this wonderful set of data here that you can all look at. And I know that it's really, and it is only up till 2022 because that's, you know, how recent this is. But if you look at the trend over time, it is not getting better. So they have the data by county, and they also have the data by managed care organization or by insurer. And I know that sometimes we think that the county-based purchasing is doing better on this. And in fact, the bill, I should mention, the bill also takes away it leaves the dental program with county-based purchasing basically forever. It just says, if you're county-based purchasing, you can do this, it's fine, we're not gonna take the program away from you. But the county-based purchasing organizations don't do any better. The data shows they don't do any better, with one minor exception, and that is IM Care. I don't know who's from Itasca County here. It's a little better in Itasca County, but still not really good. So if you look at, for 2022, just as an example, if you look at the patients who are covered by these various plans, so you could have as low as 35.2% who are in Blue Plus who actually saw a dentist in 2022. 35.2% saw a dentist. And then the maximum here, the highest is is IM care, that very small, 44%. And then the average, the total is 35%. 35% of people saw a dentist in that year. That's bad, and the data does not show it getting better. So I'm not saying that taking the program away from them is a magic bullet, but for goodness sakes, we gotta try something that's different than what we've been doing year after year after year, and see if we can't improve this, because it really matters to people's health, and this should be easy. Dental care is not as complicated as some of the other things we do in healthcare, right? People should be able to have a cleaning and a checkup in a year. Every child should have a cleaning and checkup in a year. And honestly, if we really got ourselves together, we could set a goal in this state that no child should have dental caries, because it's a preventable disease. We don't have to have kids going to school with rotting teeth and in pain so that they can't learn. This is preventable, but we've got to do something to change what we're doing so that this can actually happen. So members, I urge you to vote green on my amendment. Thank you.
Further discussion to the amendment? I recognize the member from Dakota, Representative Ryer.
Thank you, Madam Speaker. Thank you, Chair Liebling, for bringing the amendment forward. I want to start just by talking about why I brought this legislation forward and what it does. First of all, I am completely on board with what Chair Liebling said about the need for dental reform, about the need for structural health care reform. Our healthcare system, from medical to dental and everything in between, is broken. And we know that. We see that in the cost and the lack of access to care. So I'm on board with that, and I was delighted in 2021 when this went through. What I also know, though, is that when you have a systemic change, there is a whole process of risk management that's really important to do. You look at the places where you know that things could be challenging and cause breaks in the system, and you anticipate as many as you can, and you do put plans in place to be able to prevent them. And there are going to be a whole lot of things that you don't know, and those are going to happen, and you're going to work to fix them. It's just really basic premises of project management that did not happen here. And that's the unfortunate part. So the important thing, though, is that I'm not in any way saying that we shouldn't go to the single administrator. We agree on that. We need the single administrator. We need to make the change. However, the area of how much dentists get paid, what that looks like, is deceptively complex. When you have multiple managed care companies and county-based purchasing working with multiple clinics, and they are trying to incent, as a part of their contract, participation in the network, rates vary. And so to go back and say, how are we going to keep this fragile organizations whole? Because think about it, some of these clinics have a vast majority of their patients in Medicaid or Minnesota Care, and they're already on the edge financially. We need to give them stability while we look at what the best system is to say, how do we take all of these varied rates? How do we make a system that is simplified, that has an elegance, a streamlining to it, that will allow our system to become stronger? And that's not a snap of a finger. And since that wasn't in the original language of the bill, the legislation that we passed in 2021, it's not happened. Chair Liebling's wording changes are helpful, but they still don't take the structure of the rates and make them workable. So other things that are in the bill are not as core. They aren't as make or breaks for success. But we need time to get the rates done. In the meantime, why wouldn't we make the system better? Why wouldn't we think about, are we measuring outcomes in a good way? Because going in once and getting your teeth checked does not say that you're achieving oral health or that our kids are healthier. Having managed care plans in the work group, of course we do, because we need that single administrator to coordinate with the managed care plans who are still going to be doing the medical. And people are whole. It's so artificial to have mouths and teeth and the rest of our bodies separate. So we need to have them part of it. Not to drive the dental part, but to make sure that we have an integrated system. So I think that, you know, the pieces that we have here, that we're doing here, it's really the core driver of it all is to manage the risk, be responsible about it, not try to get to perfect because there is no such thing, but to make sure that we are genuinely putting the members, the people who are getting care, the people who need to get care first. I've talked to so many dental providers and asked them what the rate increase helped them with. And they said it allowed us to hire more people and retain them. It allowed us to expand our facilities. And when you look at a rate increase that passed in 2021 and you look at data from 2022, there was no time for any of those things to happen. It's a process that does take time. So regardless, I think looking at more up-to-date data would be practical if you want to go down that path. We did exclude the county-based purchasing plans. They're one of the innovations that we are also in the underlying bill building in through expansion of the karma model. Expanding the opportunity for county-based purchasing to be put in place in rural Minnesota. So for me, it struck me as pretty inconsistent to say we're going to pull back from county-based purchasing organizations that have been in place and are showing actually some more up-to-date positive changes. Pull back from there, but then at the same time say to different counties, go ahead and do this. So for me, it really does give us an opportunity to build the system that we can. We have the right people at the table. We're talking to, we're centering the needs of the dentist, centering the needs of patients. And with all due respect, I really ask for a no vote on this amendment. Thank you.
I recognize the member from Traverse, Representative Backer.
Yeah, thank you, Madam Speakers and members. The original bill that was put into our overall health bill was from Representative Ryler, and it's a good bill. One of the things, we do need to get to the solution for our dental. I actually helped, not even a constituent of mine was actually, I think, Representative Sawicki's constituent. I know that she was having problems getting dental care on medical assistance for her daughter and actually went to Alexandria for that. So the reason I would ask you to vote no is the group plans to study a better way in this for reimbursement. The talk that reimbursements in dental care is horrible is correct. We in Minnesota need to do a better job. Unfortunately, I don't believe the amendment that's on the floor would do that by changing that, so I would ask for a no vote on this so we can figure out a way to get more dentists in medical assistance instead of less. So thank you.
I recognize the member from Hennepin, Representative Nadeau.
Thank you, Madam Chair and members. And thank you, Representative Liebling, for the work that you do. I stand and I recommend that we don't vote for your amendment, however. You know, the language that was passed in 2021 put a benchmark in place that said, 55% of the population, regardless, be it fee-for-service, managed care, however people got their dental care, they were supposed to hit this 55%. And if we didn't do that, then we would kick in a single dental administrator. And I don't think anybody is really opposed to that, but I think the problem is if you look at the dashboards that are out there at the Minnesota Department of Human Services that talk about this, nothing's really changed. And one of the biggest problems that we have, and we talk about it here all the time, and it's rates. It's reimbursements. It's making sure that there's adequate resources that are going to go to the providers so that they can provide that care. And if you look at the dashboard, you'll actually see that utilization is dropping. And so what Representative Reier, and I appreciate Representative Reier's approach to this. I mean, I don't agree with everything. Representative Reier and I don't agree on a number of things. But these are things where, as you mentioned, we need to be flexible. There's no one single fix that we can get to. And Representative Reier's proposal is taking this in a way that we can actually get there and try to increase utilization. That's what this is all about. It's all about how do we get more people for preventative dental care and oral health. And so, members, I would ask that you vote no on the A13.
I recognize the member from Dakota, Representative Bierman.
Thank you, Madam Speaker. A lot of what I was going to say was mentioned already by my co-chair and the vice chair, and Representative Reier, also the vice chair of the committee, has been doing the work to make this program work already. She's been working with Senator Bolden, and there's been serious work on this dental single administrator reform plan. And I just stand to rise and say to vote no on the amendment. Let's let this work continue, and we'll get a better result in the long term. Thanks.
Any further discussion? Representative Liebling.
Thank you, Madam Speaker. So, members, I do want to direct your attention to one point here in the bill, which is being removed by my amendment, and that is there's been some discussion of the rates because the underlying law does bring the rates back to the fee-for-service rates, and that is a concern, and it's a concern that I share. But Representative Reier's bill that's here before you also does that. What it says is that the dental providers, the payments have to be based on rates that are recommended by this Dental Access Working Group. But if the rates don't get established in law in 2 more years, then the rates are at the fee-for-service rates. So it does the same thing, it just kicks it down the road a couple of years. So, the idea that, another thing I just have to say, in this, if you read this carefully, what you get is that a group of providers is supposed to come out with a plan, and then there's a very strong sort of implication in this law that we're all just going to do what they say to do, including especially implementing the rates as they say to do them. Well, you all know that there are a lot of groups that ask us to increase rates, and we need to do it, and it's a hard thing to do. That's a big ask. It's usually a lot of money. It's a complicated deal. But I just do want to point out that this same bill still has the same problem that's being complained about as the underlying law. It takes it back to the fee-for-service rates. if we haven't implemented something else in 2 years. Now, one further thing that I do want to say, and just to remind everybody, yeah, there was a 55% benchmark in the law that we put in 4 years ago, and that was a compromise. Because at the time, by 2021, it was already very, very clear that the system was not working. And this was a compromise to give the insurance companies 4 years to see if they could do better with the help of DHS, with some improvement plans and all of that, and that we put more money into it, and we made some other improvements to help improve. So this didn't happen, but I just want to point out the obvious. Even if they got to that benchmark of 55%, 45% of your constituents would still not be getting a single dental visit in a year. So even if they hit this benchmark, it would be nothing to be proud of. It's kind of a bare minimum. But the point remains, whatever you call that, whatever that benchmark is, the point remains that the system is failing and that it's time to do something different, something, and not wait another 2 years to be back in exactly the same situation where if the legislature hasn't reformed the whole rate structure, we're back to the exact same point. So members, please vote green.
The clerk will take the roll. The clerk will close the roll. There being 32 ayes, 92 nays, the motion does not pass and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Hewitt moves to amend House Bill number 2435, the second engrossment as amended. The amendment is coded A20.
I recognize the author of the amendment, Representative Hewitt, to explain the amendment.
Thank you, Madam Speaker. Would you like me to explain it or put the underlying amendment on too?
There is an amendment to the amendment. The clerk will report the amendment to the amendment.
Hewitt is moving to amend the Hewitt amendment to House Bill number 2435, second engrossment as amended. The amendment to the amendment is coded A29.
I recognize the member from Dakota, Representative Hewitt, to explain the amendment to the amendment.
Thank you, Madam Speaker. And the amendment to the amendment simply puts into place how I want the original amendment to go. In the original amendment, there was some HIPAA issues with my amendment, and I got them corrected with a secondary amendment.
There's an amendment to the amendment at the desk. The chief clerk has reported the amendment. We're good. What would you like, Representative Hewitt?
I think, Mr. Speaker, I think we're ready to vote.
Ready to vote? Well, not quite. I recognize the member from Traverse, Representative Backer.
Not so fast, Representative Hewitt. We will have a more robust discussion on the amendment itself. For just timing, we'll accept this amendment to amendment, and then we'll get into the amendment. So I would ask members to vote yes.
All right, any further discussion? All those in favor of accepting the amendment to the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment to the amendment is adopted. Now to the author of the underlying amendment, Representative Hewitt.
Thank you, Mr. Speaker, and thank you, Chair Backer, there on agreeing to this amendment to the amendment. I'm going to ask a few people to yield, if that's okay. Mr. Speaker, could I ask Representative Scarba to yield?
Representative Scarba will yield. Representative Hewitt.
Mr. Speaker, I'm sorry, Representative Scarba. I'll get that name right someday. Representative Scarba, can you tell me?
Scraba.
Oh, my name's been screwed up a lot. So can you tell me what the average EMS response time is in your area from high to low?
Representative Scarba.
Thank you, Representative Olson. Speaker Olson. It varies, and I say it varies. Like in Ely, it can be 5 minutes. In North Home, it can be 45 minutes to 90 minutes, depending on the day. But usually not sooner than 45 minutes in a lot of the district that I represent.
Thank you, Representative.
Representative Hewitt.
Mr. Speaker, if I could ask the fine representative there from Ely if he could continue to yield for a question.
He will continue to yield, Representative Hewitt.
Thank you, Mr. Speaker. And Representative, is it true that your area got $3 million to do a Sprint Medic model last year?
Representative Scarba.
Yes, Representative Hewitt, we did.
Representative Hewitt.
Thank you, Representative. And Mr. Speaker, if I could ask Representative Murphy to yield for a question.
He will yield, Representative Hewitt.
Thank you, Mr. Speaker. I'm Irish, so I got his name down. Representative Murphy, can you tell me if your area received a $3 million grant from this House last year for EMS?
Representative Murphy.
Thank you, Mr. Speaker. Thank you, Representative Hewitt. Yes, that's true. They were part. I messed it up too. They received the pilot program money for the EMS.
Thank you, Representative Murphy.
Hewitt.
Thank you, Mr. Speaker. And last but not least, Mr. Speaker, if I could ask Representative or Chair Acom to yield.
Representative Acom will yield. Representative Hewitt.
Thank you, Representative Acom. Could you tell me if you heard from one of your cities about EMS response because you're in a metro area?
Representative Acom.
Thank you, Mr. Speaker, and thank you, Representative Hewitt. Yes, I did hear from one of the cities in my district with concerns about response time being as long as 45 minutes in my suburban district.
Representative Hewitt.
Thank you, Rep, and thank you, Mr. Speaker. Members, this is great. I really got to praise Representative Chair Backer for his work in the public where he goes and responds to calls, probably did it all weekend, and his work he did on this bill. This is not a terrible bill, but what I'm concerned about is last session, this very House put in $24 million to rural grants for EMS. They put in another $6 million, so a total of 30 to rural EMS services to try Sprint Medics. Metro, none of these members on this side received a dime, not a dime, but yet they're still having the same problems you are. We yielded to your districts to make sure you got funding, which was the right thing to do. Now, members, as a former EMS person, I want you to know it's okay to say no to us. It's okay sometimes to say, you know what, we want to help you, but we also want to look at what it's going to, because this is the people's money we're talking about. You don't always have to satisfy people. We have to do it in this chamber all the time. We have to say no to kids. We have to say no to seniors. We have to say no to schools. It's okay to do that. It's okay to question first responders because this is the people's money. And what I'm asking you to do today is vote green on the amendment. And all this does is, A, it pauses one part of this, which I'm sure, like me, I've been getting calls all weekend from ambulance directors, so that tells you the amendment's good. All weekend, I've been getting calls from ambulance directors telling me that this is the terrible thing you're doing to EMS. We're going to come into your district and we're going to tell you that Mr. Hewitt does not support EMS. I love it when they do that because they did it in my last election and I won big. So I hope they do it again. But here's the deal. It's okay to question them. Don't be afraid. Don't be afraid to vote on this amendment because we need to question them because it's the people's money. And what am I talking about here? I think the Medicare, Medicaid inflators are great. I think Chair Backer did a wonderful job representing himself on that. I think that the money that Chair Backer is putting forward for the unreimbursed rural ambulances is a great idea. The one part I want to pause on, because we have $24 million and another 6 out there that we don't have the reports back on yet. We need to have the evidence that this is actually working or what is working. I'm not accusing any service of doing anything wrong. All I'm saying is that we need to make sure where this money goes is going to the right place or where we can make it go better. Because the problem is still there across the state. That's something I hear every week from people over and over, that we still have a response time. But you and I both want to know that where the money is going is helping, or maybe it's not. But we need to figure this out, and that's what the task force did last year. We worked on it together. And I'm also asking for implementation of the task force again. It was a bipartisan group that did big work for EMS. And I can't believe what the president of the Minnesota Ambulance Association did to this House in an article in MinnPost last week. May 9th, he said the legislators have to step up. Members, you have stepped up. You have done a wonderful job for EMS. No other state in the union right now is doing what you have done. Thank you. But don't be afraid to question that. Don't be afraid of MinnPost or articles. Please, members, vote green on the amendment. We are going to ask for, I'm asking for a roll call, Mr. Speaker.
A roll call being requested. There are 15 hands. There will be a roll call. Representative Hewitt.
And I don't want you to think of this as a gotcha vote. This is more to cover my rear. Because that 24 million, I have no doubt if there is some questions, I'll be in front of Chair Robbins' committee. So please vote green on it. I know there's other people who want to talk.
I recognize a member from Traverse, Representative Backer.
Thank you, Mr. Speaker and members. And first of all, thank you, Representative Hewitt. You know, right before our break, Representative Hewitt and I met. We talked about where money should go. And because of our meeting and what you shared, that's really where I thought, okay, yeah, we need to put more money into the rates. And then also you recommended, which I took, is we need to put more money in the uncompensated no-load program. So we had that meeting right before Easter break, and they were good ideas. It's something that I heard from other members, but of course, with your experience, I really value that. You know, as you know, last year, forming a new EMS division was not something that got this person excited. But we did it, okay? And also the Sprint Medic program wasn't something I was too excited about, but we did that. And one thing with that new EMS division, members, that is what they're there for. Director Ferguson does a phenomenal job. He really does. And just from a little bit of research that I was able to do, I can share with you where some of that $24,000 was spent. In Virginia, which got $500,000, that was helped with the operation margin because they were running a deficit. PERM, 550. Did I say 500 million? I meant 500,000 for Virginia. Okay, if I said that wrong. PERM, again, helping with the operation of the business. $550,000 there. And they also funded to remount an ambulance. If we look at Carleton, they use their money for the operation margin. We go on to Northfield. They also use their money for operation because they're running a deficit, which all of us all across the state was hearing about, even in the metro area. And then they also helped to purchase a new ambulance. When someone dials 911, you do need an ambulance. Personnel just don't do it, okay? Us EMTs showing up on foot just doesn't cut it. Ely, they helped with their operation margin. They also have not spent all their funds yet because they are looking, they were concerned about how, if they were going to get any additional money for salary in the future. Morris, Representative Anderson's area, they received to help with their operation. A couple things, they also added a full-time paramedic, some safety equipment, and facility maintenance. Lake Cities, they increased salaries by 20%. Stretchers, airway equipment, training software, backup generator for the main station, which is important too. Marshall, again, equipment and so forth. Tonight at the Browns Valley City Council, they're voting on how to use the $53,000, which will be 4 pagers, because we have a new EMT, my nephew, and I had to drop off my pager when I left town this morning at a little after about 5:30, because I was on call all weekend, folks, when I got back in the district. So we have to play any, mini, money, mo pager between myself, my twin brother, and my nephew right now. So we do have this data. Is it complete yet? No, the program's not over. But just randomly, none of this information would go in front of Representative Robbins' committee. I'm really concerned about this amendment also because it delays aid to rural ambulances. One of the things that I heard throughout the year is this is what saved our butts. There would have been ambulance deserts, and when there's ambulance deserts, that means call times take longer. And because of the new EMS division, I really believe that can collect that information. And I'm not so excited for another task force because that's why we have that EMS division. And let's talk about data. One of the biggest challenges with collecting additional data, I'll use an example. When we have an ambulance run that goes to Beardsley, Minnesota, so does Beardsley have to report that data, even though it's done by the Browns Valley Ambulance? How about if Graceville has to come over and help with us with the mutual aid? So it's a lot of extra work on the 850 cities in Minnesota, not just here in greater Minnesota, of course, that's where my heart is, but in the metro area too. Because the metro folks, the hospital systems, do a lot of transfers for us in greater Minnesota, which is very important. So members, I would ask for a no vote. As people know, I could go a long time on EMS, but I'll save you. So just vote no, please.
Any further discussion to the amendment? I recognize the author of the amendment, the member from Dakota, Representative Hewitt.
Thank you, Mr. Speaker, and thank you, Chair Backer. You kind of made my case. We need data. We need data because that's how you make your investments around the state. We need to find out how much it takes to get to the representative from Ely, how much time it takes from them to get the call to get to the person. We can't just shoo that. The task force worked. We need to look at the task force. And then the data that we're requesting, also, it's so important where you hear where that came from. That was from our State Fire Chiefs Association. They're the ones that said, hey, there's a problem here. There's a problem here. And the data that you see, that I used to see, basically registers the time from the time the ambulance leaves the garage till the time it gets to your door. It doesn't register the time that the ambulance gets towed or that the phone call comes in. We need to change this, and that's why we need to look at it so we can come back as a EMS team for the House and say, hey, this is what we need to invest money in. And yes, only $9 million of the dollars. He still gets his, and I didn't think of that idea, that was yours, on the reimbursement account. He still gets that. They still get the Medicaid, Medicare reimbursement. But what they don't get is a pause on the other $9 million until we have the reports back. Where Representative Backer got that, he had to call around. The reports are not due for another several months, which upsets me because we should have had them. And I don't believe that we'll have trouble like this, but anytime there's money out there, all of us know that it's sometimes free game. And that's the only thing I'm concerned about, is to make sure we put guardrails in place. Mr. Speaker, I ask for a green vote.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The clerk will close the roll. Oh, we have a remote vote now. Excellent. The clerk will call the name of the member voting remotely.
Hussein.
Okay, here you go. Hang on.
Aye.
One more time.
Hussein, aye.
Hussein votes aye.
The clerk will close the roll. There being 65 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Hollins moves to amend House File Number 2435, the second engrossment as amended. The amendment is coded A25.
I recognize the author of the amendment, the member from Ramsey, Representative Hollins.
Thank you, Mr. Speaker. I rise today to address a matter of utmost urgency: bare shoulders. As my colleague and co-chair of the unofficial Hot Tub Caucus, Representative Greenman, can attest, there is nothing less acceptable on the House floor than exposed shoulders. While democracy teeters, economies shift, and climate change grows ever closer, let us not be distracted, because nothing threatens the dignity of this chamber quite like an unconcealed upper arm. Shoulders, as we all know, are a gateway to chaos. Once we let them roam free, what's next? Open-toed shoes? Elbows? Our democracy simply cannot function under such scandalous conditions. This is about tradition, decorum, and the belief that true leadership begins with concealing the upper arm. Our ancestors didn't found this great nation so that we could flash a hint of our deltoids during budget discussions. And it is in the spirit of Representative Greenman's concerns that I offer the A25 amendment. This amendment would require complete shoulder coverage anytime a person is using a hot tub. I know you can't believe this, but I'm including some very reasonable accommodations, including you don't have to do it if you're age 5 or under, and you don't have to do it if there is a medical concern that keeps you from being able to conceal your shoulders. We also made sure to eliminate shoulder coverings when folks are in hot tubs by themselves. If you're hot tubbing solo, where nobody can see your disgusting shame, you are allowed to go without shoulder coverings. Mr. Speaker, would Representative Greenman yield to a question?
Representative Greenman will yield to a question. Representative Hollins.
Thank you, Mr. Speaker. Representative Greenman, I know you've been working very hard on this bipartisan hot tub bill. And I assume it was simply an oversight that you did not include shoulder coverings as a part of this bill and legislation. Can you please expound upon your opinions on exposed shoulders in hot tubs and the need for decorum in spaces?
Representative Greenman.
Thank you, Mr. Speaker, and thank you, Representative Hollins. So folks who know me know that I am serious about decorum and serious about hot tubs. So I appreciate this amendment. This is not my bill. The esteemed author of the bill is Representative Schultz. So I think I need to ask him, and I may in a second, or ask you to ask him. But what I will say is, since I have been on this House floor, our former colleague who I came in with, who's now in the Senate, Representative Rasmussen, and I have had lots of conversations about a bipartisan caucus that maybe classes up and adds blazers to our dress code. I think there's also bipartisan opposition. And I love the idea of a swim blazer. And I think it could be a burgeoning small business idea of the swim blazer industry. But in all seriousness, I do have a different level of decorum and dress code for off the floor and for in a hot tub. And I will say, don't let this conversation distract you from how good this free the hot tub bill is, because right-sizing regulation so that a hot tub on a houseboat and a hot tub off a houseboat are regulated the same, which is what this bill does, seems like pretty common sense to me. And as a member of the DFL Hot Tub Caucus, I really hope our Republican colleagues have the same. I think it would be great if there's more opportunities for folks to enjoy themselves in their swim blazer or not. So thank you, Representative Hollins, for bringing the amendment. I'm not sure how I would vote on this. I would ask if you want to ask my co-author, Representative Schultz, to yield and see what he thinks he'd like to do with this amendment.
Representative Hollins.
Thank you, Mr. Speaker. Would Representative Schultz yield to a question?
He will yield. Representative Hollins.
Thank you, Mr. Speaker. Representative Schultz, how do you feel about the A25 amendment?
Representative Schultz.
Thank you, Mr. Speaker and Representative Hollins. You know, it's hard to distract from this just incredibly important moment, because hopefully the members of this entire House are gaining an understanding as to the importance of freeing the hot tubs. That's what this conversation is about. And whether you want to wear a shirt in a hot tub or whether you want to go in a hot tub without a shirt, that decision should be left for you.
Representative Hollins.
Thank you, Mr. Speaker. Well, as you can tell, I clearly disagree with Representative Schultz. But I would like to thank Representative Greenman and Representative Schultz for working so diligently on this bill. I'm sure we can all agree that when you're sitting in what's essentially a human soup pot, the gravest threats are not bacteria or slipping hazards, but those scandalous clavicles and shoulders that are causing all the trouble. So we clearly need to have some more conversations about this, and so I will withdraw the amendment today. But I know that my brave colleague, Representative Greenman, will continue her quest to protect the sanctity of all cherished spaces, one shoulder cover at a time. Thank you.
Representative Hollins withdraws the amendment. There are no further amendments at the desk. The Chief Clerk will give the bill its third reading.
Third reading, House File Number 2435, as amended.
Third reading. Discussion to the bill. I recognize the member from Hennepin, Representative Nadeau.
Wow, I didn't know I was going to. Thank you, Mr. Speaker and members. This is an interesting bill that you have in front of you, and it also has an interesting timeline. There hasn't been a lot said about really the guts of this bill, and so I'm going to go over a few of the things that I think are important and that you need to consider as you vote either for or against this bill. In this bill is the first ever hospital-directed payment program. This is a program it'll try to stabilize medical assistance funding for our hospitals without raising any additional state dollars. State-directed payments are not new. There's 40 of these across the state where they leverage federal funds to help the underfunded Medicaid providers. 40% of Minnesota's hospitals had negative operating margins in the last year, and it's estimated that hospitals and related healthcare systems collectively were underpaid by over $1 billion. And that's just for MA. So this is a really good provision in the bill. It's you know, there's a lot going on at the federal level. We don't quite know what's going to happen, but we have to try. What else is in this bill is a single MA. It's the single medical assistance PBM. 1.2 million Minnesotans are enrolled in medical assistance. 97,000 are on managed care, and about 210,000 are on a MA fee for service. That's 28% of our state. Last year alone, our carriers lost $572 million on this population. This particular state PBM, the single PBM, it really acts as a pharmacy benefits administrator, and it develops an interesting Minnesota actuarial acquisition cost that will hopefully drive down the cost of drugs. It increases dispensing fees. It's ultimately projected to save the state $23 million in the out years. But until we get this program operational, this bill includes Representative Bonner's bill that provides short-term prescription dispensing payment add-ons. What else is in this bill, and we've talked a lot about EMS, is in this bill. It changes the non-emergency medical transportation administration that we need to monitor closely. It books a lot of savings that I'm not sure are going to be there in the long run, but we know that that's a huge problem, and that's a huge problem in the metro and greater Minnesota. It authorizes swing beds for Representative Scraba's district, which was interesting to learn about swing beds and how that works. It moves the hospital surcharge out of the general fund directly into the healthcare access fund. It provides early detection, outbreak response, and infectious disease prevention. One of my favorites, it adds spoken language interpreter work group that, and it also establishes an important dementia services program. And then for Representative Torkelson, it increases the base adjustment for Rare Disease Advisory Council. There's a few slight reductions and tail eliminations to a few of the programs in the bill. But I think the most important thing we need to talk about today and recognize of what's not in the bill. There's no funding for Minnesota Care in this bill. There's no new taxes in this bill. There's no better reimbursements for direct service providers in this bill. There's no planful approach to what may be coming our way from D.C. in this bill. There's no recognition and response to the economic realities of our healthcare system and how we continue to put people into our public programs. And if you missed this when I said it earlier, 20% of the population of the state is on medical assistance. And while that's an important program and a vital program and a necessary program, and it's a program that we all have to fight together when the feds try to reduce those costs to us, at the same time, we have to make sure that we're moving people off of our public programs and measure those things because we know how important that is. What's also missing from this bill is a strong partnership on the part of the agencies. I talk about healthcare a lot and how important it is and how important the partners are. And it's our healthcare providers that we all meet and we tour and we go visit. It's the payers. It's our plans. Some of us like plans, some of us don't like plans, but they're the ones that that basically take on that risk, for all of our insureds, but primarily for our medical assistance program. It's our agencies that are also should be one of our partners, and it's us. It's the legislature, and we sit and we make a lot of decisions, and we try to fix a lot of problems. And honestly, I think we sometimes do it too quickly. I think we do it in a knee-jerk way. But we are also one of the biggest partners in our healthcare system. What's not in this bill, there's $8 million in cuts to the Minnesota Department of Health. And I want to back this up. This is something that our side tried to negotiate really hard as we kind of tried to move this bill forward. You know, the Minnesota Department of Health budget ballooned, and I want to step back. Whenever I do this, I have a tendency to make people mad on your side of the aisle, and I don't want to do that. When I talk about agencies and I talk about growth in the agencies, I work for the county. I know the work that we do, and I value that work, and I respect the people doing it. But in 2018 and 2019, the Minnesota Department of Health budget was $220 million. In 24-25, that budget is $670 million. The work that they do is important, but none of those dollars pay a claim. They don't pay a salary. They don't allow us to, move forward and increase eligibility. They play a part, but the defense of the agencies is profound. And we have to find kind of a new, everything is on the table. And the Minnesota Department of Health, and for those of you that don't serve on health, it's an important agency, but I mean, let's just look at some of the statistics, some of the health statistics. 74% of adults, 50% of children are obese or overweight in America. 77% of our young adults are unfit to serve in the military. 50% of American adults, 30% of teens, 30% of teens have prediabetes or type 2 diabetes. 18% of teens have fatty liver tissue disease. 40% of 18-year-olds have a mental health diagnosis. It's the highest. Cancer is increasing in kids. 25% of American women are on antidepressants. Where is our focus? If we could just move the needle on diabetes, we would save hundreds of millions of dollars in all of our programs. So when we tried to look at this, we tried to focus, and I think this is a challenge that we're going to have going forward. We need a stronger partner with the Department of Health that's going to focus and work alongside all of our other healthcare providers, driving down those statistics. The other thing that's not in the bill that's going to be in the Senate bill that somebody's going to have to negotiate, Representative Bierman and Representative Backer and others, is, on the Senate bill, there's an enormous amount of new revenue being raised to pay for some of these things. And I don't know how that's going to end up. I don't know if we're going to, agree to that. I appreciate the bill that this House is getting ready to hopefully take a final vote on and hopefully pass. It didn't come easy. When you have cut targets like we did, it was very difficult to try to focus on those programs that we thought are going to move the needle. And so as we go into conference, I want to, I want to I guess, kind of reinforced the idea that, this bill did a lot. It could have done more. We could have maybe done a little bit more, but all in all, it's a pretty tough bill. Now, everybody's giving up a little bit. My single PBM bill is basically going to ask for a lot of money from our health plans. That was tough. That's tough to do. But we have to be focused. We have to work. We have to try. We have to be flexible. And we have to start, as Representative Hewitt said, we have to think a little bit differently. He also said sometimes we have to say no. It's really easy, apparently, to say no to, some, but it's impossible to say no to the agencies around here lately. And when you have a 75% growth in an agency that is dollars that we're not able to use in our healthcare system, I think that's a problem. We shouldn't just hold that aside and say, you know what, that's untouchable. We don't say that to our health plans. We don't say it to providers. We don't say it to doctors and nurses. We basically say, you know what, we're going to increase the number of people that we're to put on our public programs, and you've got to pay it. You've got to pay it. I mean, let's take Minnesota Care. I've been told that it's going to get fixed at some point, but it's not in this bill. We get $1 billion from the federal government. The state puts in about $300 million, and right now, that $300 million is not in this bill. And something's going to materialize, I hope. But right now, it's not in there. And if, in fact, it doesn't go in there for whatever reason, DHS has to have an actuarially balanced budget. And they don't just get to run out of money in August or September. They will literally reduce capitation rates. They will literally reduce provider reimbursement rates, which is something that we've talked about here ad nauseum that we don't do, and we all support. We all support increase in reimbursement rates. But it can't come at the end just as the only way we're going to increase reimbursement rates is to tax our providers, to tax our plans more. That can't be the only answer, members. Thank you, Mr. Speaker. I encourage those of you who can and want to vote green on this health bill.
I recognize the member from Ramsey, Representative Perez-Vega.
Thank you, Mr. Speaker. Boy, my hand feels like arthritis. I'm sure everybody's been signing all those high school graduation rates, and that's important to notify even on when we're talking about health and we're talking about our children and we're talking about our families, because my life changed when I was a high school junior and was diagnosed with type 1 diabetes. And so when we talk about my life and health and thinking about the several children and the several families that's lives change as a community, needs to be reflected on about what's not included, what's been not considered to include in this bill, and that I hope that every member in this chamber, as we're working together here, recognizes as we move forward into going into these conference committees and trying to reach deadlines and seeing how special things get in here. Because I've got a lot of my constituents in my district and your district that are concerned specifically about what's happening at the federal level when we're addressing hunger and we're addressing food and we're addressing that we gotta preserve a little bit here and try and balance this. And I heard a lot of words talk about equity, but I think about the 16-year-old girl as I'm writing, and shoot, I'm making 20 years into my high school reunion, but I think about the privilege that I may have had, but that was completely erased when I hit the mark of going to college and was not qualified to be under my parents' insurance. And I not only had to think about the medicine and the health care and the great doctors that I once got to see when I was 16 that was no longer an option when I got off of that health insurance as my parents, and thinking, moving into 22 years forward from that, how much things have been able to change through legislation that we've been able to push in my first term here when we talk about accessibility to having meals served and having pharmaceuticals pay attention to these prices that determine our lives. I think about the several constituents of mine that they don't maybe have an issue of having to skip a meal or determine what their dinner plan is going to be the next day, but a majority of them do. I think about when I walk into this chamber, and before I even get into the steps of this beautiful Capitol, I think about the circles of folks that go around a building that are mothers, that are fathers, that are veterans, that don't have that accessibility or are fearing to lose it when it comes to putting groceries into their homes. That helps them not have to wonder if their stomachs are not going to be able to take this medicine that they may be able to afford or not. So, we have a lot of work to do. We're trying to come together and make sense of this, but I want to make sense as to why people don't think it's important to figure out how to keep food as a priority for our own well-beings. And as somebody who needs food and medicine to live and to be here, to be healthy enough to raise my daughter, to be a part of my community, to be a representative in this chamber, when we say we're going to put this on the shelf instead of actually putting more food on the shelf and actually providing more accessibility for workforce to have jobs to help these counties determine what is the data that's coming in, how many mouths are we feeding on. So, as we're going into this bill, I'm going to be honest, and I told my chair, are you sure you want me to talk on this right now? Because my constituents aren't satisfied with losing accessibility to understand how to move forward in their counties, in their spaces, without having accessibility to interpreters, or maybe somebody that has the connection to be able to fill out those large packets for them to have accessibility to SNAP, or have accessibility to medicine that should be continued to be affordable, who should have accessibility to be able to go into a space with a practitioner that knows what their family has gone to. Those services are very important. I don't want to have this broad borderline when we talk about what it is to be a child, facing a chronic illness, and not knowing what's there to be tomorrow. I want us to work together that we have to face an opportunity to be able to make less stressful for those families, less stressful for the parents that are worried about how they're going to have to pay more for those people who have cancer, for their children who have diabetes, not because they're obese, but because it's something that's environmentally placed or genetically embraced. You may be laughing at the other side, I see, and that's okay, because what's not funny is what's going to happen in your districts when people are hungry. When your constituents are going to say, but there was $500,000 at a federal level right there to match for accessibility for jobs to be able to go ahead and have more food on the table with SNAP. I don't think it's funny when there's solutions that we can work together to bring more opportunities for accessibility, whether you're on this side of the aisle or that side of the aisle. I don't think it's funny for the moms who are talking to me about saying, I don't know if I'm going to have more accessibility to feed my kids, and I'm working 3 jobs just to pay a mortgage. I don't think it's funny when there's volunteers who don't need the extra funds to provide for their family, but they're working every day to see the folks that need the food. that they need the more options and resources, and that the counties are coming down to talk to us to say, we don't know what's going to happen in 2 years, but we sure that all of you guys get it together because we need your help. And I think that's what we're trying to do here with our children and families is we need to help. We need to have accessibility to the taxes that are being paid by those who are documented and undocumented to help and provide so that those families are not crying and saying goodbye to their loved ones because they didn't fill out a form right. They didn't have any options, whether they're in Hibbing, Minnesota, or Rochester, or Worthington, or Wilmer, or Mankato,
Point of order, Mr.
or
Speaker.
just in Inver Grove Heights.
State your point of order.
Thank you, Mr. Speaker. I rise to a point of order under Section 110 of Masons that we need to address our comments to the presiding officer. Section 110, number 1. Thank you, Mr. Speaker.
I remind the body that it is the rule of the House and the custom and usage to speak through the speaker when addressing the House. Representative Perez Vega.
Mr. Speaker, my apologies. Mr. Speaker, I was directing that to Representative Lawrence. Would you yield to a question?
He will not yield, Representative Perez Vega.
Okay, good. Thank you, Mr. Speaker. I'll take back to the floor and the mic again. What am I doing? What am I doing? I'm just speaking to everyone in this chamber right now. Mr. Speaker. Mr.
Yes,
Speaker.
Representative Perez Vega.
I think the smiles, the laughters that I've heard in committee, the commentary that we can work together in here, we're facing a large impact that's going to happen in each and every one of our districts, from the capital city here to the northern grade of this state to the bottom. I don't know how I want to vote on this, but I sure hope my colleagues in this committee that we can consider about coming together for when we want to put food on the tables and we want to bring resources and jobs, Mr. Speaker, to those that are there, and when there's federal funds that are not frozen for that accessibility to provide more work, food, and healthier families. Thank you.
I recognize the member from Todd, Representative Wiener.
Thank you, Mr. Speaker. I tone it down a notch, I guess. I speak today on an issue that strikes at the very core of good governance, legislative transparency, and moral responsibility that we owe to every citizen in this state. And that issue is the abuse of omnibus bills. Omnibus bills are not just a procedural flaw in our legislative process. They are a deliberate tactic used to obscure, manipulate, and bypass the public's right to transparency and accountability. And today I want to talk about how this practice not only violates sound legislative principles, but how it's being used right now to force Minnesotan taxpayers to participate in something that many of them find deeply objectionable. And that's the public funding of abortion. So I'll start with the basics. In civics class when I teach my kids, we discuss that bills should be addressed as one subject, and that it should be debated openly, and our elected officials should vote yes or no based on the issue alone. But that's not what we do here anymore. Instead, what we get are bills that are hundreds, sometimes thousands of pages long, crammed with dozens of unrelated provisions, many of which have never even had proper hearings, and some of which would never survive a straight up or down vote on their own. This isn't just bad governance, it's dishonest. You know it and I know it. People in Minnesota know it. So let's talk specifically about the health bill. Tucked inside this bill are provisions for the public funding of abortion, paid for by you, the taxpayer. This isn't health care, this is a moral issue. It deserves its own debate, its own bill, and its own vote, but it didn't get that. Instead, it was buried inside of this bill, mixed with dozens of other unrelated measures, some good, some bad, but all lumped together in a way that forces members of this body to make an impossible choice. Do I vote for a bill because it includes funding for hospitals in my district, even though I oppose taxpayer-funded abortion, or do I vote against it and risk losing the health care investment my constituents desperately need? That's not democracy. That's coercion. And the people of Minnesota deserve better. So let me be clear. This is not just a debate about abortion, it's a debate about whether our government has the right to compel its citizens to violate their deeply held beliefs by funding something that they morally oppose. Minnesota taxpayers should not be forced to participate passively or otherwise in abortion. Whether you're pro-life or pro-choice, whether you believe abortion should be legal or restricted, we should all agree that no citizen should be compelled to fund the procedure with their tax dollars. This is a line we should never cross. But here's what's happening. When we allow omnibus bills to carry these kind of provisions without proper scrutiny, we hide from the people, we avoid the hard conversations, and we silence the voice of Minnesotans who deserve to be heard. So let me tell you what I've been hearing from my communities, from the people that live near me, from pastors, from small business owners, nurses, public school teachers, from parents who are barely making ends meet. They don't want their taxes going to fund abortion. They don't want it morally, they don't want it ethically, and they don't want it financially. And they don't understand how a state that talks so much about tolerance and inclusion can be so quick to dismiss their deeply held beliefs. Because that's exactly what's going on. And they're being told, pay up, be quiet, and don't listen or don't question where your money is going. It's not inclusion, that's tyranny masked as progress. So let me say once again, or be very clear about this, abortion is not health care. It's not the same as prenatal care, it's not the same as cancer screening, it's not the same as prescription drug programs. To place it under the same umbrella and to fund it as part of health care package is intellectually dishonest. We cannot have a real honest discussion about health care in Minnesota when we keep smuggling deeply controversial issues into massive bills. And we all know what's happening. We see it in the health bill, where these funded abortions are quietly normalized without the decency of a separate public vote. And I ask you, is this really the legacy we want to leave as lawmakers? Do you want to be remembered as a legislator that said one thing in public and did something very different behind closed doors? A legislator that hid legislation, that hid controversial policies, packaged and rammed through on party line votes? Or do we want to be remembered as a body that said, enough, this process is broken and we're going to fix it? We need to restore the integrity of this chamber. That means going back to single subject bills. That means we require separate votes on major issues, especially those that are moral and divisive. This means we stop playing games with Minnesotans' money and start governing with transparency and accountability. So let me say it again. This is not about abortion, this is how we govern. When we use omnibus bills to sneak in divisive policies, we undermine democracy. When we force taxpayers to fund things that violate their conscience, we erode trust in government. When we use complexity and confusion to get what we want politically, we lose the moral authority to lead. And when we forget that every dollar we spend comes from someone else's hard work, someone's paycheck, someone's sacrifice, we drift dangerously from our responsibilities as stewards of the public trust. Minnesota deserves a government that reflects their values, respects their freedoms, and spends their money with purpose and care. So today I call on my colleagues on both sides of the aisle to end the era of omnibus manipulation. Let's bring sunlight back into this chamber. Let's return to the principles of good governance, honest debate, and moral clarity. And above all, let's stand for the people who sent us here. Not just special interests, not the lobbyists, not the political machines, that everyday Minnesotans who expect their tax dollars to fund roads, bridges, and public safety, not controversial procedures they fundamentally oppose. Let's fix this broken system. Let's end taxpayers' funding of abortion. Let's bring real accountability back to our work, what we're supposed to be doing here. Vote transparency. Vote no on this bill.
I recognize the member from Morrison, Representative Kreshaw.
Thank you, Mr. Speaker. Members, we have in front of us a bill, House File 2435. I think I can read that. 2435. And I want to thank the chairs and all the members for putting this together. In the time that I've served here, one of the things that I realize is you can't control the wind, you can control the sail. And through all the work of the members, we have a bill that addresses many of the deficiencies and challenges that the residents in the district I represent have spoken to me about. For many, many sessions, we talked about the need for rural EMS, the fact that you can have all the health care in the world, but if nobody can get to you, it doesn't matter. And Representative Backer, if you haven't heard one of Representative Backer's speeches, and I think I could quote those probably as good as he could, but he is passionate about this. I have seen not only the policy side, but the passionate side of Representative Backer when unfortunate events have happened in the chamber, and he was one of the first ones to get there. And frankly, members, if Representative Backer could get from Browns Valley to every one of your districts on a call, I believe he would do that. And I say that with all the respect in the world. I know how hard your work is, and you delivered on that promise. Representative Backer and Representative Byerman, the chairs, you delivered on that promise that we needed to put rural EMS first. Alongside of that, there's direct payment program for our hospitals. Hospitals that so desperately need the funding and the support, and with the approval of the federal government, the rural hospitals can stay open. Because frankly, we can put all the money in the rural EMS we want, but if there's nowhere to go, again, we haven't served the constituents that are asking for it. As our populations age in rural Minnesota, as our families need more and more support, the programs must follow the population demographics, and you delivered on that with this bill. And the third one that I heard coming into this session was the rural pharmacies, the family-owned businesses that bought the pharmacy from the generation before them, promised to continue it through the town, promised to continue the services, not to compete with the large pharmacies, because frankly, those large pharmacies can be 30, 40, 60 miles away. They promised to deliver in their communities, and they were stuck with really bad fees and Medicaid reimbursements. You fixed that. You've helped that. So on behalf of the pharmacies that I've talked to and the people that have been in my office just saying, hey, I'm just trying to make this business go because I'm moving it from one generation to the next, and I'm trying to keep the community viable. On their behalf, Representative Backer and Representative Byerman, I say thank you. But there's other things here. Facing a $75 million target cut and a $175 million cut in the tails, you're able to deliver those three priorities. In addition, Representative Nadeau brought dementia, working on a disease that is terrible. And if you've cared for anybody with those ailments, you know how difficult it is, and anything that we can do to help is of great value. Spotting physical abuse. There's money in here to train people how to spot physical abuse. And if you've ever, and I hope you never have this, but if you've ever looked in the eyes of a child that is going through an abusive situation who can't speak and is just hoping beyond all hope that somebody will see that and be able to call attention to it and break that cycle, it's one of the most powerful things you can do. So to have money in here that trains and helps people see that, that's frankly amazing. I mean, the life of one child, I think of my 4 daughters and my son, and my goodness, if they were ever in a situation or if they were ever had somebody in that and they were crying for help and couldn't get it, that's horrific. And I've seen those children. I've seen those families. And it's a cyclical thing. And a lot of times it's fueled by poverty or chronic inebriation or an addiction. But there's cycles. And if we can just break that cycle, we can start to bring in hope, we can start to bring in recovery. And that starts with a simple provision like this of just spotting it, just asking the question, just finding a way to get to somebody, a small child who's in the darkest of the dark places. And the last one that I'll bring up, which I remember it coming through Commerce, and Representative Stevenson is off the floor here, but members, we face an ailment and a demon so dark and deep that we don't even know it, and that is the social media addiction. And just the simple thing, I remember in committee when we heard this bill come up, and I thought to myself, and all of us that are familiar with technology, the tech companies are fighting a simple warning about social media. And I thought, my goodness, these are the smartest technology people who are squawking because they can't come up with a little code that I could write in 20 seconds with ChatGPT just to put a warning on. That's ridiculous. The kids today that are so addicted to screens and what it's doing to them, and it's doing something. We are going to look back on this day. I'm going to look back on it with my grandkids and my great-grandkids, and I'm going to wonder how we could have done more. This is eating their brains away. They're looking at screens and forgetting the power of the words and the stories that propel us to have individual and creative thoughts. This is a small provision with some of the largest repercussions and hopefully positive things that we can have. So yes, I'm a green vote on this. Yes, I am a green vote for the families that need the Medicaid. I'm a green vote for the families that are trying to get out of the most difficult spots. And in a time when we're looking at a $6 billion deficit, this might be one of the only beacons we have going forward. So thank you for the bill. I'll be voting green on this bill, and I hope we can get this to conference committee where you're going to make it better, Representative Bierman and Representative Backer.
I recognize the member from Candy, Ojai, Representative Baker.
And thank you, Mr. Speaker and members. I also stand to support the bill today. I want to thank our co-chairs, Representative Backer, Representative Bierman, for your great work on this, and the committee members that spent many, many hours going through this very challenging series of issues that I've had a chance to sit through my tenure here in the Minnesota House. I want to thank you for one of the bills that I carried was the opioid directive bill. This is an important new bill that now family members and people that want to have a conversation with your doctor ahead of time, but when people are struggling with substance use disorder, when they know that they really don't want to ever have another opioid in their life because they have been through hell and back again because of either overprescribing, misuse, whatever it might be, but they have gotten on a path of recovery and they're doing really, really well. And now, with the passage of this, we can actually talk, they can have a private conversation with their provider, say, Doc, if I ever get offered an opioid pill again because of an accident or an injury, and if you're not here, I want to put in my doctor's, my electronic health records, don't ever give me an opioid again. Give me something else. And that was a really good discussion we had. We picked up the idea from another state. It's a simple form. The Department of Health can put this together, quite low cost. It's very low cost. But now the doctors are certainly immune from ever accidentally prescribing something. If somebody is unconscious and you're not there, you're out of state, out of country, no provider is going to get in trouble if you are trying to help somebody and doing the right thing for them. But 90% of the time when that comes up, your electronic record, do not prescribe an opioid, find something else. That is, I think, a really important part of this bill that I'm proud that we were able to try to tell people ahead of time, this person has asked privately, don't prescribe me an opioid. Let's do something different. And there's a lot of other great options now. Again, a lot of things have already been said. This is a good bill for hospitals, rural hospitals. This is a great bill for pharmacies, especially the small independently owned pharmacies. The dispensing fee is a big, big deal. That's the only way pharmacies can make money. It isn't by selling enough soda and pop and chips and other things. They do something in the retail, but it's all about the dispensing fees. That's really important to these folks. And I tell you, just EMS alone, too, just that's a big win for us again. We do not and cannot let our 911 numbers go silent and having long delays in our rural communities. So this is a really big deal. So again, a lot has been said. I'm voting green on the bill. But also, I just want to take a second to talk about the collective bargaining agreements again, as I mentioned on Friday, with our hospitals. Our hospitals need us to also pay attention to the paid family medical leave coming up here in this conversation in this coming week. We have 1 week left. We can make some changes that will help our hospitals recognize what they have worked hard on over the last decades of giving their employees the time off that they need to raise their families, to be with their families when they're little, to be away when you're sick. But if we compound this, members, with more mandates on their rules of how they give benefits to their employees that have been negotiated over the years, we've got to do the right thing this week. This is the week to do it. A lot of conversations right now are happening amongst members, and I encourage anybody that has other ideas to talk to me about 2 or 3 things that we're trying to talk about. The benefit set is important. The definition of a family member is important. So I hope that when we do this and go forward, we not only support today's health bill, and we support a lot of the bills that we're all working with together in a very bipartisan manner, and I'm really proud of a lot of the things that we are getting to. But I want to remind everybody, we've got very important financial considerations for all these businesses coming forward that we're trying to help every single day, and it includes smart employment benefits like paid family, earn sick and safe, and let's do the right thing by making some tweaks this week. So members, please vote green on the health bill. Thank you.
I recognize the member from St. Louis, Representative Scraba.
Thank you, Mr. Speaker. First, I want to thank Representative Bierman. It's the first time I've ever been in front of the Health Committee. It was interesting, the case that I brought, the bill, how accepting everyone was on both sides, and they signed off on the bill after I brought it there, and now it is here in front of us this evening. And I'm thankful for everyone seeing that it's a good bill and that the hospital administrator from Cook County made her point so that we're here today. I want to thank Representative Backer, not Bakers without a C, Backer, inside joke, for all the EMS stuff. Believe it or not, right now, as we speak, EMS is activated in northern Minnesota. We have 3 fires, 1,200 acres, 1,500 acres, and 300 acres. It's moving north. It started in Brimson this morning, and it's jumping fast. It's a big emergency. Again, the federal government has their people. Everyone is worried, are the feds locked down? Do they have money to do this? They have money. Everyone is working together. The incident command is working, and the EMS folks are all ready. It's important that this bill, for me, when I read it this morning, or the synopsis, it was like, wow, there's a lot in here that really, really affects the people I represent. And as the more and more I went through it, and yes, there are some downfalls. I'll be the first to admit there are some things in here that are really hard to get around. I wish Representative Zalesnikar's amendment would have passed, because some way, shape, or form that will come back to this body. But just reflecting on the bill itself and how hard it is to get something like this through right now. Kudos. Kudos to the two chairs, the co-chairs, and everyone else. Obviously, I am agreeing. Thank you very much.
I recognize a member from Isanti, Representative Gordon.
Thank you, Mr. Speaker. You know, I personally believe that we should protect life in every stage. My friends on the other side of the aisle have a different view of when life begins. Putting those differences aside, though, I think we should all be able to agree that taxpayer funding of abortion should never be. Now, I know there's a Supreme Court case, a Minnesota Supreme Court case that says we're required to provide this funding. I think one thing we should remember in this body is that sometimes it's okay to challenge authority. There's nothing wrong with asking the court to reconsider. Vote red.
I recognize the member from Ramsey, Representative Finke.
Thank you, Mr. Speaker. Members, excuse me, I want to take a moment just to talk about reproductive and sexual health care. This bill reduces our sexual and reproductive health care services grant program by $1 million per year for the next 2 years. These grants are essential health care to our districts, to all of our districts, and to all of our communities. These SRHS grants are used for birth control, mental health care, hepatitis vaccines, cervical cancer screenings, STI screenings and treatments, and many, many more services. Our sexual and reproductive health services grants, however, are not used for abortions. We do not use them at all to fund abortion. We've heard a lot about the funding for abortion in this bill. We don't do that. We also don't hide our funding for abortion. We're proud to fund abortion health care for all of our members and for all of our communities. So we don't need to hide it into bills. We will do it because we believe in it. But our SRHS grants do not fund abortion. And it's interesting, given the comments that we've been hearing, that we are cutting these grants for everything but abortion care because these grant cuts are going to hurt Greater Minnesota's communities more than they are going to hurt those in the metro. I have letters here, many letters sent to our health chairs from clinics across Minnesota pleading for us to restore this money that does not go to abortion services. I've got letters from clinics in Representative Knutson, Bliss, Wiener, Reimer, Jackson, Rapinski, Gander, and more, pleading with us to restore this money. One of them says, the Polk Norman Monoman County Health Board has been a recipient of this grant since the early 1980s, and the funding is critical to ensure our patients have access to family planning services like contraceptive counseling, screening and testing for sexually transmitted infections, and referrals for other medical and mental health care regardless of their insurance status. I know that we disagree, as was just said, about abortion care. Whether or not we are funding abortion is a different conversation or not. But we hopefully can agree that cutting reproductive health care that we can all believe in is not going to be good for our communities. We can agree that cutting sexual health funding for cervical cancer screening is just going to hurt our communities. I think that people are doing this to try to do damage to Planned Parenthood, and you might do a teeny amount of damage to Planned Parenthood by taking this money, but what you're really doing is taking essential healthcare services from your own voters. I appreciate the difficulty of putting together a bill like this, and I understand why we are here. But I do want to make sure we take a second and recognize that in the name of one thing, we are doing something else that is much more damaging. So I hope that as this bill goes forward, we can figure out a way to restore this essential funding. And when we are ready, Representative Wiener, I would love to talk about asking the voters to decide on abortion.
I recognize the member from Morrison, Representative Schultz.
Thank you, Mr. Speaker, and I rise tonight to talk about one of the big elephants in the room. This idea that taxpayers should be funding illegal immigrant health care in Minnesota. While the program that funds that program is not seen inside of this bill, I think that we need to be asking ourselves why, Mr. Speaker. Minnesota Care, since January 1st of this year, has been providing for health care for people who are here illegally, and over 20,000 illegal immigrants have signed up for that. And our tax dollars are going to fund that. And I brought House File 10 this session, which would ensure strong eligibility requirements to ensure that no illegal immigrants would be getting Minnesota Care paid for free by Minnesota taxpayers. And it's not seen inside this bill. And considering that this is the area of the budget where we would fund Minnesota Care, and considering, Mr. Speaker, that when that bill was in front of the very health committee, I heard members on the other side of the aisle asking me, Representative Schultz, isn't this going to lead to more uncompensated care? And I'm left with this question. If we're not funding Minnesota Care at all inside this bill, what's the result going to be to Minnesotans across this state? And instead of using a little bit of Minnesota common sense and ensuring that tax dollars are staying with Minnesotans, it would appear to me, Mr. Speaker, that the political left in Minnesota thinks that we need to continue funding illegal immigrant health care. So I wanted to ask, Mr. Speaker, would Representative Ryer yield to a question?
She will yield. Representative Schultz.
Thank you, Mr. Speaker. Representative Ryer, is there a reason that Minnesota Care isn't found inside this bill, which would be the funding mechanism for Minnesota Care?
Representative Ryer.
Thank you, Mr. Speaker. Representative, I really couldn't tell you. I am not negotiating that.
Representative Schultz.
Thank you, Mr. Speaker. Would Co-Chair Bierman yield to a question?
He will yield. Representative Schultz.
Thank you, Mr. Speaker. And Chair Bierman, could you enlighten the body as to why there's no funding mechanism for Minnesota Care inside this health budget?
Representative Bierman.
Thank you, Mr. Speaker. Representative Schultz. Minnesota Care was not included in the framework of the budget agreement that we are working on now. This is a global issue that the leadership is resolving, and I fully expect that this will be coming back in the very near future as we close up this next week. We do need Minnesota Care. It's imperative, and we will be seeing that soon. Thank you.
Representative Schultz.
Thank you, Mr. Speaker. I didn't hear the answer to that question from the co-chair, who I believe he is the chief author of this bill, as to why 116,000 Minnesotans wouldn't be receiving their Minnesota Care if this bill were to become law as written. So I guess my open question for us is, we're trying to establish the state budget. We are 1 week away from the end of this legislative session, and we're trying to establish the state budget, which has to be in law and in place by July 1st of this year. And I'm looking at this knowing that this program, Mr. Speaker, has already exploded for illegal immigrants. I mean, we were projected to only have 7,700 people enrolled in this program at its peak, Mr. Speaker. And there has already been over 20,000 people who have enrolled in that program. And by the way, Minnesota taxpayers are paying for all of that, 100%. Now, that's different from every other Minnesotan who is found within the 116,000 Minnesotans who are on Minnesota Care. Because, Mr. Speaker, we usually get a federal match on these dollars. And while I know there's some in this chamber who don't like talking about the good things that are happening in Washington, D.C. to get our country back on track and to bring about the golden era in America, we have a Congress that just introduced a bill today from the ever-powerful Energy and Commerce Committee that said that states cannot be funding illegal immigrant health care and expect to receive the same level of support for Medicaid. So are Democrats in this state going to continue to drive a larger budget deficit in the name of supporting illegal immigrants? I think that's the question right now, with 1 week to go. With 1 week to go, Mr. Speaker, will this House of Representatives, will this legislature fund the needs of Minnesotans and Minnesotans first? Or will this legislature, and particularly Democrats in Minnesota, Mr. Speaker, will they place the needs of illegal immigrants ahead of the needs of Minnesotans?
I recognize the member from Hennepin, Representative Green.
Thank you, Mr. Speaker. So I rise to talk about the House Health Budget Bill 2435, and I need to talk about the $6 million of funding that is not in this bill, that had been dedicated to long COVID funding in the Minnesota Department of Health. I'm in support of the health bill and want us to keep moving forward here, but I have to bring this up because this is an issue. And it's an issue because it impacts the state of health in our state. I got COVID early on. I used to joke that I was an early adopter. So in April 2020, when there was no testing available, I noticed that my voice did this weird hiccup, and I couldn't really take a breath in. So I went online and I took a quiz, because that's all you could really do, and realized that I should probably go into isolation. And that hiccup continued and continued and continued. So on day 3, I'm still in isolation. The state finally opened up the first drive-up testing that was available. I'm forever grateful for People Center. One minute. So this is at Cedar Riverside. So I pulled up. I was in a long car. I didn't realize I was going to get this emotional. It's been 5 years. And they did a test. Immediately, he's like, "You've got COVID." He gave me a pulse oximeter, and I left with steroids. And he said to me, "If you drop below 90, you can go to the emergency room, but they won't admit you before that." 90. Hanging around 90% is not something I recommend. So I made it through those 10 days, but what followed continued, and you could hear my breath catching like a whistle all the time. So a month later, I landed in the ER with a full asthma attack. And another one a few weeks later. Wow. When I decided to run for office, someone said to me, "If you can get your emotions in check, you might be a really good legislator." So anyway, but I talk about this because this funding is really important. It was months later before I was ever able to get to a pulmonologist. I did breathing tests, and I was set on a year of steroids. My diagnosis was asthma, and that was the first time I ever heard the words. Someone said to me, "long COVID." I'm like, "What? Long COVID? What is that?" And that was 5 years ago. I have asthma, and it will never go away. And it has created a ripple effect on my health. Catching a virus is not the same anymore. And when the pandemic ended, the talk about COVID quickly faded into the background of conversations. And just like that, people wanted to move past it. Some really never wanted to talk about it in the first place. But long COVID is ever present. It is real, and it is not going away. I am just one of tens of thousands of Minnesotans who have long COVID. The World Health Organization reports that 400 million people worldwide have some form of long COVID. And my symptoms are minimal. Other lives have been forever changed. Chronic fatigue, headaches, insomnia, irregular heartbeats, lung function, gut health. Studies have found that roughly 20 to 30% of people infected with COVID experience brain fog at least 3 months after an initial infection. There are more than 200 long COVID symptoms that have been identified, and there is no cure, and it is wreaking havoc on people's lives and our healthcare system in the state of Minnesota. And I'm lucky. I had access to healthcare early on. I received a diagnosis, I received care, and I have a support system. And I know doctors don't have the answers because I have visited them. The impact of long COVID on individuals is profound, and it is wildly still unknown. I cannot emphasize this enough, the stress on our healthcare system. Representative Nadeau was talking about stresses on our healthcare system. This is one of them. It is complex, it is costly. I shudder to think of what is going to cost us as a state and for individuals like myself in the long term. I can hardly think about what's ahead for me. But it is a problem that no one is talking about anymore. So I rise because I want to keep shining the light here. I want to continue researching long COVID so we understand it, we collect the data, we provide resources, and most importantly, we have proactive care so that we can support Minnesotans. Long COVID is a chronic condition, and we just don't know much about it, and it deserves our attention. Thank you. I yield back.
I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Mr. Speaker and members. These are two bills that represent two committees I'm on, Health Committee and Children and Family, both with challenging targets to hit, both with challenging times. Our state's in a $6 billion deficit, and we have people that need services. We have children that need services and children and families. We have health issues to what the representative talked about, long COVID, and so many things. And so this budget, while it's not perfect, it represents a bipartisan attempt to address what could be addressed in children and families and in the Health Committee. And so many of the things were talked about today, and I'm not going to talk about them again, but the hospital funding is critical for greater Minnesota and really the whole entire state. That's something that we're going to win. It's a win for the entire state to stabilize our hospital services. To also stabilize pharmacy, to make sure that the pharmacists aren't going to close across the state for freestanding is really important. Non-emergency transportation. The list goes on and on. Telehealth, having that be able to be a format for mental health. We have 40% increase in mental health. That will help everyone in every part of the state. There are so many issues. The Children and Family Committee, there's just we don't have enough money to deal with all the things we want to deal with, and that's a common theme right now. Families are looking for childcare. Childcare workers want to make more money, and the owners are losing money. So it's a complete opportunity for disaster. And in the Children and Families Committee, I just want to say thank you. The SSIS system for the counties will be funded. And that has been the same system that was in 1991 when I started in St. Louis County. And that will help us be more efficient. So that is multi-millions that is going to help 87 counties. And cameras, right now, we have systems right now to help for maltreatment. We have some systems in place for child care centers. We did some things for family child care too. Right now, my biggest concern on children and family is, are we adding slots? Are we doing things to improve wages? And are we stabilizing it for the people that own it? And so much of it, the answer's been no. And so to see that we can increase slots to find us, get more openings is the big thing. We built a new agency down here in St. Paul, and I believe it was $16 or $18 million that we set aside to create a new Department of Children. And we moved it from DHS. That did not create one slot for a new place to get childcare in the state of Minnesota. That's the disappointing part to me, not the principle of creating a new department. It's just the timing. Was this the right timing? I would argue no. But the money's been spent. We've got a new agency. We grew government, and we didn't add any slots for childcare. And that's a common theme across the state. So people are very frustrated, and they have every reason to be frustrated. And so I was excited to just get an exemption for family child care. We've lost so many family child care providers in northern Minnesota and across the state. And I had to fight in order to get an exemption for a child care provider for an 8-year-old, for one of their an 8-year-old child. That's somebody in school, to be exempt from the child care ratios. So now at least those that are doing child care in their home, if they have an 8-year-old or older, they can exempt one kid, which will hopefully help them. And a variance, common sense variances. If a child care center is short 100 square feet and they should have 2 more children, giving them the right amount of children to the teachers. If they had 2 teachers, they should have 14 kids. And when they only have 12, they're losing money. And it's not only losing money, but the centers aren't serving all the kids they could serve. So we did some things to help out, and it's still not enough. And we're fully understand that it's not. And I trust that the chairs, when we go to conference committee, I'm going to support this bill for all the reasons I've talked about, in hopes that we are going to make the bill better. When it comes back from the Senate, that the chairs from family, I believe, and the chairs on the Health Committee, I believe that they will work in the best interest in a bipartisan way for the state of Minnesota. Thank you.
I recognize the member from Washington, Representative Hemmingson-Yeager.
Thank you, Mr. Speaker. So it's not every day that an issue that gets discussed actually threads its way through all 3 committees that I serve. And this session, that issue was food and food insecurity. We all know that access to healthy food is essential to your overall health. And we know that food insecurity hits all corners of Minnesota. We heard this loud and clear in the Children and Families Committee, and then I heard about it in the Veterans and Military Affairs Division hearings. Earlier this session in committee, we learned that 34 truckloads of food were canceled with no expectation of being restored. We're hearing that the need continues to increase and the instability people and families are feeling as the federal government continues. They're making them do more with less, whether that's due to grocery store prices, tariffs, or losing health care. So where do these families turn to? They go to their local food shelf. I'm hearing from food shelves in my community, like Open Cupboard and Today's Harvest, that serve the constituents. And as this bill is currently written, they're gonna feel that impact because they're not gonna get the funding they need to support our constituents and my communities. So the impact of that is gonna be a decreased amount of produce, a decreased amount of milk, and a decreased amount of protein. You guys all know those are the building blocks of our meat and potatoes and our breakfast cereals that we need every day. So as we move into conference, I ask that you think about the food shelves in your districts, maybe the ones you volunteered at, so that we can support all parts of the food ecosystem and all links in our food chain. In addition, there's some other provisions in this health bill that I'm actually really excited to see. One is the funding for the Rare Disease Advisory Council. As we learn more about genetic diseases and treatments for them, the work of the RDAC in understanding and educating people and physicians and healthcare providers and us as legislators of the rare disease space is vital. I'm also appreciative for the Medication Repository Program. This is a program that I'm very grateful for the inclusion, as their work in providing donated drugs, ensuring their quality, and providing to those who do not have access, whether they can't afford them, is vital and life-saving. It's great to have a program that was started by pharmacy students and have it go statewide and is already having a positive impact. So in closing, there's lots that goes into health. And I want to thank the chairs and vice chairs for allowing me to be on that committee. We've been able to do some good work, but looking at the uncertainty ahead, we still have a lot more work to do. We need to ensure that MDH can protect us with their public health provisions and that people can access the health care they need when they need it. Thank you, Mr. Speaker.
I recognize the member from Chippewa, Representative Van Bensbergen.
Thank you, Mr. Speaker. I just want to thank both the chairs. I sit on the Health Committee as well, and appreciate your work. I know it hasn't been easy, the work that you both had to do together. And I hesitated to rise to speak on this because I'll be voting no. But I believe the Health Committee has missed the mark to some degree. And it's around premiums, and it's around cost of health care. We've had very little discussion about that. I'm a business employer. I employ people. I've done that my whole career. And every year, I dislike the first part of the year because we sit down and we look at our budget and we discuss the year ahead, and our biggest cost is our health care. It's bigger than our salaries that we pay and our payroll. It's health care. It's our biggest item on our balance sheet. And I believe we need to have a different focus. And how are we going to reduce costs for people that, employees of mine and people that are living in all of our districts? And costs are out of control. And I just believe we need to have a new focus on how are we going to control costs. The mandates and the regulations have taken over this state and has driven costs through the roof. And so I hope we come back to this discussion of how are we going to lower costs for the citizens of Minnesota. Thank you.
I recognize the member from Pine, Representative Nelson.
Thank you, Mr. Speaker and members. As we look at this bill, there's a lot in it. There's maybe a lot that isn't in it, and maybe we're glad for that. Maybe some of us are upset about that. But one of the things that I want to highlight is the SSIS funding, the Social Systems Information System, the funding for that. When I first came in 2019 in a special election, it was a bill I had inherited. It had been worked on before my time, and it'll probably continue being worked on into the future, but I'm hoping that the funding we have will be sufficient to get this more than just off the ground, really get it up and running and functioning as it should. It's been talked about quite a bit, but it's a system that really manages data, it manages files, notes, anything on an individual that touches health and human services of any person, whether from prenatal all the way through senior citizens and into after they've left this earth. So it's quite comprehensive, this system. And as I inherited this bill, I carried it, didn't really get a whole lot of traction. Representative Jess Hansen, she kind of picked the bill up a year later. We got a study done, and it showed the desperate need for this. And as I've been talking to the counties that I serve, hearing from their social workers, how much time they're spending on data entry. And they didn't go to school to focus on data entry. They went to school, they went and got their education, their training, everything they have to help people, to focus on individuals, children, families, focusing on the individual. And they're spending anywhere from 70 to 80% of their time working with a system that will probably crash before they're done. They'll have to start over several times. And they're frustrated with it. And, you know, this is something that needed to desperately be updated. And I knew it was going to be a challenging lift, but I think one of the things that I've been working on is building awareness for how important this is. The efficiency of a new system is so important. You know, we would love to see being able to spend 70 to 80% of their time working with the individual, helping the people. Representative Creasure, you talked about people in crisis and helping them. That's what we need to be doing, is helping people instead of spending their time with an IT system that's nearly 30 years old. And I'm excited to be able to get funding for that and to be able to get this across the line. The Senate has a lower target, but we're going to make that right with our target and fully fund the change on that. And I want to thank the chairs of Children and Families Committee, Chair West and Chair Katiza-Watun. Thank you for the work that you have done on this and being able to work together on getting this funding. And I think I think all the members of the committee have seen the importance of funding this program. And I think it was one of our top priorities amongst other things, but this is something that's very important, and I'm glad to see it done. And I will be voting green today. Thank you.
I recognize the member from Goodhue, Representative Altendorf.
Thank you, Mr. Speaker and members. I rise today and I have a question for everyone. The question is, what costs more in Minnesota, a year at the University of Minnesota or one at daycare? And maybe shocking, very surprising to many, the answer is center-based infant daycare in Minnesota. According to the Office of the Economic Status of Women, it costs over $20,000 a year to have an infant in daycare, while the average at the University of Minnesota is $15,000. Members, this is a stat that we do not want to have. That was from the Minneapolis-St. Paul magazine. From the Minnesota Reformer, child care costs more in Minnesota than almost any other state, the study finds. And this is disgraceful. This is a terrible thing for us to have, a stat for us to have, and many people are questioning expanding their families because of this. I've spoken to many people that run daycares. Our in-home numbers have drastically cut in Minnesota, and that is due to the regulations, the government burden that we put on these employees. We oftentimes in this chamber were legislating to the what ifs, the 1 in 1,000, the 1 in 10,000, and no doubt many of us have good intention, but it's not practical and it's costly. Moving forward, I hope in 2026 that we can actually look at increasing the number of slots that we have for daycares, and that we take a serious look at our regulations so that we can make daycare more affordable for our Minnesota families, because this is very important to the future of Minnesota. Thank you, Mr. Speaker.
I recognize the member from Dakota, Representative Ryer.
Thank you, Mr. Speaker. First of all, I want to thank the co-chairs of the committee, Chair Bierman and Chair Backer, and Vice Chair Nadeau, and all staff, because it's been a very interesting, collegial, and hardworking committee, so I thank everyone. We did work to look out for people in big ways and small ways. Structural things that you heard about, funding hospitals, funding pharmacies, EMS, dentistry, finding a way for foreign doctors to be able to bring their skills and practice in Minnesota. We've looked out for individuals, some of the things that we've mentioned already, dementia services, which are extremely important for my constituents. covering traditional healthcare practices, Representative Keeler's bill, spoken language interpreter work group, and the social media. So the things that are hitting people one-on-one where they need help, and the opium and addiction services. One place, though, that I want to speak about in particular is the role of public health in Minnesota. Because I think that there are so many ways that the Minnesota Department of Health serves our community. So many of them stay below the surface for us until something goes wrong. So just for example, there's a robust set of climate and health pieces, environmental health. And these are things like agriculture and food security, dealing with extreme heat events and water changes, things that harm businesses, farmers, people just living their lives in Minnesota are affected by these. The Department of Health is there to help us understand and make plans to work around those things. Issues related to healthy aging, helping people cope with the onset of dementia, of other diseases of aging, finding resources that they need, and infectious disease and epidemiology. Of course, we're all familiar with the COVID example, but we also live in a global society, and we've seen cuts to federal agencies like USAID, cutting funding that's going to go to help manage infectious conditions elsewhere in the world. They're coming our way. We don't have impermeable boundaries. So we want people who can be looking at all the different diseases. We want people who are looking at foodborne diseases, waterborne diseases, vector-borne and zoonotic diseases. We need those services, and I just want to be sure that as we go in and wonder what agencies do for us, they operate at a level of macro health that we all depend on. They also help all of our counties. If you go out and look at probably most of the counties in the 87 states, and you go and you click on a link to get information on a service or a condition, go check it out. I bet a lot of them go back to the Minnesota Department of Health website because they have experts there so that we don't have to have experts in all our counties. They can have one person who can help be the knowledgeable source to support Minnesota. We depend on them, and I just wanted to take this opportunity to thank all the public health workers. Thank you, Mr. Speaker.
I recognize the member from Anoka, Representative West.
Thank you, Mr. Speaker, and yes, it has been a long time, and the bill is wrapping up now, so you all can be very happy about that. Next bill should be nice and quick. But before I get started, I want to thank my committee staff and my co-chair for being awesome. This committee has been so much fun. Children and Families Committee, if you're not on it, you're really missing out. You get candy every single committee meeting, and, you know, we actually have a little bit of fun and act like children, just to stay in the theme. So quickly, I wish this bill did a lot more, at least the children and families portion about reducing costs. It does a lot of small things, but for reducing costs, I don't expect this bill to make a tremendous difference, but it certainly shouldn't be growing costs. And with 2 kids in daycare, I pay $900 a week. 2 kids. This legislative salary is completely gone. It is brutal. So if you want somebody who cares about lowering the cost of childcare, yes, I'm your man. The modernization movement, where we're going to take all these daycare rules and put them into statute, is going to be finished next year. So we were hesitant to make substantial changes to the regulations because, well, we're almost there to make a huge push. But rest assured, anybody who's watching this that is thinking, I'm paying $900 a week for care, oh my goodness, this isn't going to help. Help is around the corner. But in this bill, we put just under $6 million more into early learning scholarships. There's many, many millions spent in public assistance and childcare, CCAP. And what we've seen is that's what we've always done. We've always spent billions and billions and billions and billions of dollars on this. Yet somehow, costs just go up and up and up and up. You can't only attack one side of the equation. All that does is cause inflation. And that's exactly where we're at right now. Whereas if you're fortunate enough to receive assistance of some kind, childcare is more affordable. But if you're doing better at making money in life, but not fabulously wealthy to where a spouse can stay home, you're in this brutal zone where you have too much to qualify for any assistance, but you don't have enough to where it's no big deal. You can spend this kind of money. And that is not a sustainable system, especially when just every single neighboring state has significantly lower childcare costs. So we're surrounded by people, even Illinois is better than us at this, which is very depressing. So this bill is a start. It's not enough, and honestly, I don't think anybody thinks any of our bills we're passing are enough. But it makes important investments in what needs to be done. It provides some regulatory relief, thanks to Representative Nadeau, Representative Zalesnikar, Representative Coulter also has some terrific provisions in here, as does Representative Waller. But next year, we're going to be well set up to make some significant reforms to reverse this trend. I would just love to be tied with one of our neighboring states in childcare costs. That would save me a ton of money. But it would also open up opportunities for many people who might like to build a family greater than one or greater than three, but they couldn't possibly hope to afford it. And that's just sad, because kids are awesome. They're literally my favorite thing in the world, because I get to brag about my children, and everybody either deals with it or they like it too, because if you've seen their pictures, they're absurdly adorable. And I will show you, if anybody wants to come by, I will happily serenade you with pictures. But in closing, which I know is a favorite phrase of the representative in here, we need to make it easier. We really do. It's tough. And government generally is in the business of making it more difficult, not less difficult. So when we rip open these regulations next year and really get into them and have our departments focus on health and safety and not on all these other factors that are just driving up costs for minimal gain, we will be able to make it there. The children and families portion of this bill is 1 to 4 steps in that direction, but we have a long way to go, and I would urge members to support the bill.
I recognize a member from Hennepin, Representative Katiza-Watun.
Thank you, Mr. Speaker, and thank you, Chair West, for your partnership in this. Before I really get into it, I want to thank all of our staff, our DFL partisan staff, Joe Durheim, researcher, Caleb Rohr, our CLA, Coley Colburn, my right hand, and then Vice Chair Hansen for all her work and support. Our GOP staff, Lauren Hayward, CLA Elizabeth Luca, and Will Golding, and of course, Vice Chair Nelson. Our nonpartisan staff, Doug Berg, without whom neither Chair West nor I could, put two numbers together. Annie Mock, Danielle Pugnelli, and Sarah Sunderman, and our reviser, Dean Treffs. All of the advocates for making this job a lot easier because they are uplifting those who need our support the most, and then the incredible DCYF team who have been working tremendously hard over the last year to put this wonderful new department together. So with that, I do want to talk about some of the really, really good provisions that are in this bill. I think that we know that investing in people and investing in our littlest learners is what will build a better future here in Minnesota. And so this bill does that, right? We have about $6 million of food security funding. We have improvements in our child welfare processes. We have an additional one-time $6 million in scholarship funding to get us over the $100 million number for scholarships in this coming biennium. We have a lot of great program integrity provisions. We're moving forward on electronic attendance monitoring, some federal compliance issues, both in licensing and capacity compliance. And I can't forget to mention the $40 million of SSIS funding as well. That's going to make a tremendous impact on not only the services that we are able to provide to the children and families of Minnesota when they are going through child welfare or child protection difficulties, but also to our workforce. To the caseworkers, to the social workers who work with these populations, thank you. I know it is often a thankless job, and these kids depend on you. And so with what Vice Chair Nelson said earlier, with all the work that members on both sides of the aisle have done to get this funding across the finish line, I appreciate that, and I am excited to see that move forward. We have investment in FAME, which is Family Assets for Independence. This program helps people who are experiencing poverty in Minnesota lift themselves up by their bootstraps. It's a matching savings program that allows them to work toward a goal and includes financial education to help make sure that they can stay out of poverty once they lift themselves up. And Chair West did talk about the licensing updates, the small things that we're able to take a step forward on this session, but we do look forward to making some additional improvements next year in a policy year. Improving those processes to better protect children and make it easier and more efficient to open and run a successful child care business will also help build a better future here in Minnesota. Ensuring that bad actors aren't taking advantage of our public programs and taxpayer dollars will build a better future here in Minnesota. There are a couple provisions that I hope go to conference and never come back again. Eliminating the 10% bonus for child care providers is going to hurt child care providers. The letters that Representative Coulter read earlier show the impact that it's going to have. And so when we talk about growing our child care workforce and we talk about increasing the number of slots for children, we have to consider the fact that taking compensation away from the people who depend on that is probably going to have the opposite effect. Excluding our largest food bank, who provides sustenance for 33 counties in greater Minnesota, will hurt the 1 in 5 people in our state who experience food insecurity. So I hope that doesn't come back from conference. And I'm just going to leave it at that. I think that we have a long way to go to make sure that all the kids in Minnesota get off to a great start. This bill does take us one small step in that direction, and I appreciate all of you staying awake for the portions of the Children and Families Bill that weren't as relevant or as exciting, that maybe had a little bit more of a health tinge to them. So thank you, and vote green.
I recognize the member from Traverse, Representative Backer.
Thank you, Mr. Speaker. First of all, I know Cole Bierman and I would agree we could not get this job done without the wonderful support we have. So I want to go through that. First of all, on the DFL side, we had CA Jack Dorgendorf, CLA Morgan Durfree, and then the DFL researcher Joe Durham. Nonpartisan, of course, Annie Mack, that helps write everything, Elizabeth Clarkvis, and then Joe Harney, big help. And then Paige Natalie Hammond. On the GOP side, Jonathan Carter, of course, my CLA, Caitlin Scorby. They got to put up with the most amount of backerisms. And then we had the vice chair, of course, Vice Chair Nadeau and Vice Chair Ryer. We got to know each other extremely well, and I appreciate our disagreements. We had quite a few of them. At the end of the day, we have a bill. My top priority was improving public health. This bill does it a whole heck of a lot better than on the other side. It's to support life, and this bill does support life. It helps all of EMS, it helps all of hospitals, it helps Karma, which is a county-based program which no one talked about, and that helps us in greater Minnesota. Helps pharmacy, and Representative Krisha is correct. If I could respond to runs across the state, I would do such. I like doing that. I like helping people in their greatest time of needs. On our side of the aisle, we got reduction in the sexual reproduction grant, which was important on our side. The biggest challenge I would have to the DFL side, that would be, of course, Co-Chair Bierman and Vice Chair Ryer, is, and I know you guys would have the same frustration on the other side with our importance, but I think it's so important to support the systems than the agency. We had robust discussion on that many times, and if we don't support the systems, and I like to compare that with education, if we don't support the schools, then the kids don't get taught. If we don't deliver what needs to get delivered, if it's EMS, hospitals, pharmacies, dentists, then services are not delivered, folks. That is the bedrock of public health in supporting life. Did we do a lot of good stuff? Yes. Could we have done, made changes? Yes, we could. At the end of the day, I was given a job. I was given a team that I didn't pick, which I'm not saying that the team was bad, okay? That's not what I'm saying. But I was given a team. I had no choice, okay? So I worked with what I have, good, bad, or ugly. And you may say I'm the ugly part of the team, okay? But no one can deny that we didn't work our butts off when you have 14 offers and didn't count all the little ones to do the best we could for Minnesotans and improve the health care in Minnesota. This bill is better than the other side, and thank you for everybody for putting up with a 4-hour discussion on health, which is phenomenal. So I will yield this to Co-Chair Bierman. Thank you, Mr. Speaker.
I recognize a member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, members, for this long discussion and presentation. Really appreciate it. What I really liked was so many of the comments that you made about the bill. There's a lot of good things in here, and in sort of an abbreviated year, it's going to be impactful. Thank you for thanking all of the staff. I want to thank the members of the committee itself for your hard work coming in and being diligent about the work every day. Really appreciate that. And then just go back to just the key thing that we focused on, which were, as was mentioned, some of the things. Hospitals were one of them, and I thank you, Representative Nadeau, for your bill. Directed payments, that's going to make a huge difference. It was commented about the other stressors of healthcare, and I think that Representative Krisha brought up some interesting points about social media and addiction we heard about, and also we heard about mental health. These are all stressors on the system that we haven't quite built the entire infrastructure for, especially outpatient mental health. So I'm going to put in a plug for the mental health rate reform bill that I hope is coming to a bill near you soon. And we need to take that seriously. This could be a really transformational year for healthcare if we can land that with the directed payments for the hospitals. That would go a long way toward building out that infrastructure that we need in the state, taking care of all ages, and extremely important. One of the other stressors that was just briefly touched on is our hospital ERs. And some of those things that are affecting them are the mental health, the addiction issues, but also the care that is uncompensated from uninsured or underinsured and undocumented. Members, I got a letter today actually from a CEO from a hospital south of here, about 50 miles. And he wrote and said, I'm writing in support of the health care bill. Our hospital is required by federal law to provide care to all patients who show up in the emergency department, regardless of insurance or not. It costs less to have undocumented immigrants receive preventative care in our clinics, accessible through Minnesota Care, as opposed to emergent care in our ED when they have no insurance. From an economic standpoint and the hospital's business perspective, it is preferable to keep undocumented immigrants in Minnesota Care. He gave me the average cost of a clinic appointment is $150 to $250. An ER visit, $2,500. Question is, who pays that $2,500? All of us. All of us pay that. So I'm just going to highlight that as we finish up here. Healthcare is expensive, and Representative Van Binsberg was up here a moment ago. I don't see him here now. Maybe he's departed. But he talked about, as a small business owner, trying to afford healthcare. I am the same way. One of the reasons I ran for office was the high cost of health care for my business, my employees, and their families. And we should be able to do better for small businesses in Minnesota. We should be able to do better for all the people of Minnesota. Health care, U.S. spending for health care comprises 17.6% of the entire economy. So it costs too much. I agree entirely. So I will be anxious to work on that more closely with Representative Van Binsberg and all of you, because you all own the healthcare system now. You went and got elected. That makes you responsible. I know you didn't build the system we have now, but you're responsible with the votes you take in this chamber for the cost of healthcare. Next year, we will have reports out on new plans of how we could run our healthcare system. I think it's imperative that we take a look at those seriously, because we can all agree the cost is too much. I want to thank you again for listening, the work in progress of this bill, the favorable comments I've heard on it, and I will finally ask you to vote green and move this along so that we can keep it moving and get it back from the Senate, an even better bill. Thank you, members.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The chief clerk will call the name of the member voting remotely.
Hussein.
Okay, go ahead.
Hussein, aye.
Hussein votes aye.
The clerk will close the roll. There being 95 yeas and 38 nays, the bill is passed as amended and its title agreed to.